share with you on their budgeted plans for this financial year of 2026-2027. So you will be the first, the people of Wattville, or the people of Wat 30 and the people of Gauteng, to know what is the department saying is gonna do this coming financial year. We will also receive a presentation that will focus on the fourth quarter, the one that has just ended on the 31st of March, their performance report, and this is the quarter that closes the financial year for 2025-2026. So, honorable members and stakeholders, I wish to indicate that we are gathering here today with the hope that whatever is needed by our beneficiaries from the department will be possible today. That's because you will be given the time and opportunity to ask questions. But we must remind you that you went to vote. And when you voted on May 24, there are honorable members that have been placed into the legislature on your behalf. So that's why they are here. So this committee have also asked questions on your behalf. Those are not just ordinary questions, but those are research questions based on what was happening or what is going to happen. So we will be receiving, the department will be answering questions from this committee, and we will also give you an opportunity to also ask questions. And I want you to pay attention attentively so that you don't repeat questions that your committee have asked. Otherwise, we will just be wasting time. And it is not a ward meeting. So we don't need questions from the ward. We know water are leaking. That's why councillor is gone now. We know the electricity is expensive and sometimes it trips a lot. Don't ask those questions. Look at the presentation. Look at your needs as the NPOs, how you are going to be funded and how it's going to be done. Then ask those questions. I'm saying this because yesterday evening I received a communique from the Gauteng Crisis Committee with the report indicating that there are 13 NPOs that were rejected for funding by the department, while 14 NPO are still awaiting decision from the department. And I know that the department will tell you that they are now in the process of the appeal, but they will be able to tell you when that appeal is coming to an end and when you will get the final letters that you are rejected completely. I must indicate upfront that whatever the circumstances are, it is not correct that in June, the department has not made a decision as to whether the above mentioned are to be funded or are not to be funded. There are not 14, there are many that need those answers. Remember, there are beneficiaries that are suffering from this situation, and we don't want to extend what you always know as the dry period. The dry period has to be simple. From the 1st of April until end of April, it is the dry period. Now the NPO knows that they have to make means end. But by May, they must be starting to get their first tranches. And if we are in June, you can imagine how is the situation in those NPO as we are sitting here. I will apply my mind in the submission that has been sent to me and make sure that amicable solution is reached. And I must remind the crisis committee that work with the department. Work with the department. They do have ears to listen. Give them a chance, give them an opportunity to also clarify you on why certain situation is like that. Don't just jump into the committee. I know the committee is your final line, but like we are saying, we are in the process of the appeal. And all those that have not been funded, obviously, they've written their appeals, and the department is looking at those appeals. I will look at that. So let me stop here and allow our MEC, as the political head of this department, to give us an overview of the state of affairs within this department, as she will be speaking to the budget itself, the budget for 2026-2027, And she will be also sharing with us how was the performance of this fourth quarter for the financial year 2025-2026. Honorable MEC, I will be guided by you. And I can see, and I would really want to thank you, MEC, that I can see the entire department is here. Not that they are going to answer, just so that they can feel how important is the questions from the committee and how it's so bad for the MEC if some of the questions are not answered the way they have to be answered, because we know for sure, MEC, that you cannot answer our questions from your head. It must be from the department, different directorate, chief directorate. So I'm giving you this opportunity to take us through, and then we will be guided by how you like to run this. Thank you very much.
Thank you, Chair. Thank you, Chair. Good morning, Chair, and honorable members, and good morning to the members of the community that have joined the committee, all the key stakeholders, Chair, that are here. The councillor, indeed, councillor says, "Tandicele umkhukhu kudala, Chair, so umkhukhu wami uredi manje. Une-air conditioner, makubanda siyawuvulela, kube ne-heater makutshisa, ndifake nansi i-aircon." So indeed, I've been working here with him, and we're still going to work. I was excited, councillor, when they said we're coming here, because I knew that that's where we should be. But I'm still owing you the service delivery, Chikala. Council uthatha details zakhe, because we must come and do the service delivery blitz that we're doing on Thursdays or Friday, one of the Fridays, council, so that we can sort out some of the problems. In fact, I'm going to Brakpan after this, Chair, because kuna a funeral that we're busy arranging with the comrades and councillors that side. But they were referred by the councillor, is the one that introduced me to this community. I'm known in the schools everywhere because of Fiena. And thank you, I really appreciate that, councillor, and the work that you've been doing in the community of Wattville in particular, but even in surrounding areas. You've been taking care of everyone in this corner, even assisting where other colleagues are unable to receive services from government. Chair, I'm not going to waste time. We have prepared your questions, and I know some of the questions we have not answered the way that you will want, but we will talk to those areas then that you need us to clarify further. The second issue, Chair, there is another question, I think it's question 1, that we have proposed that let's not divulge, yes, all the information here, because it's a sensitive issue. It's still sub judice, and Chair, I know you are a learned friend, which is better, although you have not done law, but you are part of that category of the lawyers. You know the sensitivity of some of the questions, that if we can say something on it while it's still in the middle of those court processes, we will definitely be in trouble. So I want to appeal to you that question, we're not undermining you when we said we are asking for a separate session. Even in that session, it will not be everyone, it will be me and the HOD that will talk to you and brief you. Until then, the process is complete, and then we'll come and tell you. But another meeting, as a Kaya, we are as a NGO, you can call me to that meeting of the NGO. Then I will talk. I'm happy that other colleagues are not here, even if we're being recorded. Then I can come to yourself and start talking to it. Yeah, and the others we have tried, Chair. The issue, Chair, that you are raising of the crisis committee, we did have a session with the crisis committee as a department. We've been meeting with them on a weekly basis. Some stakeholders that are complaining, but I want to make you, Chair, be assured, all the NPOs that we have not given their money by now, there are problems, and those problems are not with us. I've visited quite a number of them. I think I'm now sitting at almost 10 in the 5 regions. I go to all of them and find out what is the problem, and I go with my communications team, because the problems, it's not the Department of Social Development, it's them, Chair. Some are employing people. That's why you have seen last week, DDG Tibello was running, clarifying what is expected. They're employing people that are coming from outside, some of them. Some, they are not feeling some of the things that we want. There are no social workers, so they are not meeting the criteria in the form and in the SLA that is there. So, but we're not turning them back, Chair. We say to them, come forward, the directors, they are going to all the regions to correct the mistakes where there are mistakes. Then there are those cases, then, Chair, there was a budget cut, which we are busy now sitting with them so that the appeal process must finalize that, and then we give them the money. But even if there is an appeal, we give you your chunk now. Then the one that we, after the appeal will be added. If it's added, we will forward that. So that's another thing, Chair, that I think I should clarify. This issue, Chair, it's in my office now. We're meeting every Tuesday. Pity today we have this meeting. Maybe if we finish late, we'll not be able to sit, but every Tuesday we have meetings where we're discussing issues like this one. Because I don't want us to allow people bakuthi begcina abantu bethu. Comrade Ntombi? No, Chair, Supersamsuchenz. Ndisachaza ingxelo yezono apha. So I don't want abantu bakuthi to have a problem, Chair, of not getting paid. I even go to them, those that have not been paid, then I show attach immediately with the directors and assist them. Because they kept the SLAs to themselves and they are honest. I like abantu basekhaya because they are very honest. Mawubuza ukuthi, when did you submit the SLA? Athi guys submit or athi submit yesterday. Because ngeke ngahlangana nabo bafika bangibonisa what to do. So that's what I know, Chair, has been happening, and we've been clarifying so that it doesn't become ugly, this issue of us not assisting them. But we're exposing those, Chair, that we know that they kept the SLAs, they didn't come until I go to them or the directors go to them and assist them. Because as funi nathi bangathi singabantu aba-insensitive, Chair. Because if you can really sit and not pay a person, you are insensitive. For 2 months, they have not been paid. In fact, I even bring the social workers that have not paid or the staff in front of this person that is wrong, so that they can see that it's not us, it's this one. And they confirm immediately when we do that, that it's me, it's our fault, we have not done it. But we will definitely deal with these issues, Chair, as we go, because we need to make sure that we correct them. Chair, our appeal is that we don't have money. And I'm sure we'll have a discussion when we discuss the issues of budget. Our budget was cut, and we want the legislature to recommend to get our money back. We've done presentations already to the Department of Treasury with the MEC and the team. They agree, they acknowledge that it was wrong. Maybe fault was on our side, but we're clearing that we submitted all the necessary documents that they wanted so that by November, they can give us our money. And we need your voice, Chair, on that, because we'll not be given that money if you are not assisting us in terms of raising our voices together. Chair, I will appeal then that HOD and the Chief CFO, they will take us through, but I'll hand over to HOD to start answering some of the questions, and then you will delegate. We have the team chair of DDGs and chief directors and some of the directors, but DDGs and chief directors will handle the questions, Chair. Then if there's some consultation to others, we will definitely do that. But I think we will definitely answer, Chair. You are right, Chair, I brought them here, the corridor directors, just to listen and see the pain that we are experiencing when we are unable to do things the way that the legislature wanted. Hence, we are bringing them to the community to feel the pain, but to correct the wrong, Chair, because we can't keep on not doing what you are expecting us to do. Thank you, Chair.
Thank you. I think on the agenda is presentation by the social development on the budget. Ne? Start with that, and then you'll follow with the questions, answering the question.
Thank you very much, Chair. The CFO will lead us on the budget presentation. And as MEC has mentioned, I will lead the responses to the questions. If there's questions for clarity, then I will call on my colleagues to clarify those. Chairperson, with your permission, can the CFO start?
Morning, Honorable Chair, honorable members, MEC, HOD, and all community members. My name is Caroline Nzwane. I'm the acting CFO in the Department of Social Development. And I will be taking you through the presentation of the budget vote of the department for the 2026-27 financial year. Okay. The department has 5 programs, and it has been allocated 5.638 billion in the current financial year. That budget, the overall budget of the department has increased slightly by about 0.89% from the adjusted budget of 5.589 billion in the previous financial year. As you can see on the slide there, for program 1, which is administration, our budget increased from 739 million to 834 million, which constitute 12.8% of the allocated budget. So the increase there is about 94.9 million. Then for social welfare services, the budget for the department was increased by only 0.4% from the previous financial year of 894 million to 898 million. Then we have another program, Children and Families, which takes the lion's share of the budget of the department, whereby the budget was reduced from the 2.3 billion to 2 million. This is the program where we have our child youth care centers and then a children program in the department. But yes, but the budget has been reduced due to compulsory cuts that were implemented on the baseline of the department. Then we have restorative services, which is program 4. And in that program, we implement programs such as your crime prevention, support to crime prevention, victim empowerment, and substance abuse. In that program, the budget increased by 12.7%. Then the last program, which is development and research, in that program, the budget increased by about 54 million. Then in terms of the increases and the reductions that were implemented in the current financial year, for program 1, the increase is mainly due to the increase on compensation of employee to cater for pay progression. As you know that on an annual basis, we pay progression, and then we implement cost of living for all the employees that are in the department, and the filling of a critical post, because there are some posts that have been vacant for a long period, especially the senior management services, which are critical for the running of the department. So we also receive additional allocation for G fleet as well as office building in the current financial year, as we have pressures in those areas to pay the GG cars as well as the leases of office building that the department is renting. Then on social welfare services, the increase in that program is also driven by compensation of employee. In the 2026 financial year, to accommodate our annual cost of living adjustment. Then on program 3, which is children and families, where I indicated that the budget was decreased as compared to previous financial year. This one, it was affected by the reclassification of school uniform budget, as well as the cuts that were implemented on other items. The reclassification of the budget was mainly to align the budget of the department with the performance information, so that when we're reporting, there is no misalignment between performance and expenditure in the department. Then on program 4, the increase in this program was on compensation, as well as for non-profit institutions, mainly those that are doing substance abuse programs. There was an increase in those areas. Then for development and research, the increase there, it's because of the reclassification of budget to align, because the budget was moved from program 3 to program 5, as the target is reported under program 5. And then the next slide here is just to to reflect the increases in our budget or decreases on an economic level of the department, starting with compensation, where it received a substantial increase. Our COE budget has increased by 68.7 million, which represent 2.8%. And then goods and services budget has reduced. This is where we have we allocate budget for the operational cost of the department, and the reduction, it really negatively impact on the operations of the department. So in that category, the department has been reduced by 38.4 million. Then we have non-profit institutions, which the budget was increased by only 2.3%. We only received an increase of 45 million in this category. And that 45 million, it also includes your conditional grant, EPWP conditional grant. So you can see that the budget for the department is not growing at the level that it should be growing at an inflation rate. Then we have an item called household. On household is where we allocate budget for leave gratuity and injury on duty for officials that exceed the public sector. We pay them the leave that are due to them. So, however, the budget has also decreased in that one from 8 million to 6 million in the current financial year. Then our buildings and other fixed structures, as we implement an infrastructure project in the department, the budget there was also affected by the cuts from the adjusted budget of 142 to 120 million in the current financial year. Then we have machinery and equipment. This is the budget where we allocate funding for the procurement of assets and office equipment for the officials. That one also, it was reduced by 2 million. And then the reasons for these cuts, COE budget, it mainly for the improvement of cost of living. And then for goods and services, it was also affected by once-off allocation, which was not carried over from the previous financial year. The department received additional allocation in the adjustment budget. However, that budget that was increased in the adjustment budget was not carried over in the current financial year, resulting in the underspending. Then for non-profit institution, the additional allocation, as I've indicated, it is inclusive of your 13.7 million for EPWP, and then also increase for other programs. It was just slight increases. Then for household allocation, it was for a payment of leave gratuity. Buildings and other fixed structures is for infrastructure project, as I have indicated. So this next slide here, we are just giving a breakdown on the cost drivers on our goods and services budget to say what takes up the lion's share of the budget for our goods and services to run the department. We have 17 million allocated for our airtime, which is contractual obligation. We also pay software licenses for Microsoft, where the department has allocated 38 million in the current financial year. Then we have contractors that we are paying in the department, doing security, cleaning and gardening, and for that the department has allocated 115.5 million. Then we also have catering that we provide for the beneficiaries at the institutions, because the department has institutions, your CYCC, treatment centers and residential facilities. We have to provide catering for our beneficiaries. In that category, we have allocated 50 million. Then we also have fleet services for for the officials in the department, especially the social workers, when they are doing consultations at the communities. For that item, the department has allocated 84.8 million. Then in the current financial year, for school uniform, we also provide school uniform on an annual basis for the vulnerable children that are identified through the Department of Education. And in that allocation, the department has been allocated 148 million for the 26-27. Then we also have food parcel program where we provide food parcels to those community members that are in need. In that category, we have allocated 53.3 million. Then we have also another program called Dignity Packs, where we have been allocated 142.2 million. Then we also rent out offices around Gauteng to render social work services. In that category, the department was allocated 73.3 million. Then we have property payments, which will be your maintenance, cleaning, and other items. In that category, we have allocated 193 million. And then this next slide is just to indicate that the increase in terms of the EPWP budget from the previous financial year. You can see that we were only allocated an additional budget of 1.6 million for EPWP in the current financial year. And through this allocation, the department will be able to create 405 job opportunities and training and to capacitate our EPWP practitioners. Then the next slide is just to outline the breakdown in terms of the infrastructure projects, because we also implement infrastructure project through maintenance. We also construct new buildings as well as refurbishment and upgrade. So we are saying that over the 2026 MTF, a substantial amount of our infrastructure funding is reflected against existing infrastructure asset through maintenance and repairs of the current buildings, and then which indicates that a provincial direction in focusing on maintaining and improving the existing assets before they deteriorate. The focus is also on upgrading and renovating our state-owned facilities, including our institutions, to ensure that they are brought to an acceptable condition. Because as some of our buildings are very old, so we need to constantly make sure that we maintain them. And then the department will also continue to support the maintenance program, as this will assist in deriving maximum value and protecting the life cycle of the asset. Then we are also saying that the departmental immovable asset need to be properly refurbished. So through the allocation of 206 million that has been allocated, the department will be able to implement all this project that we have planned for. And then the next slide is just to give a breakdown of exactly how this 206 million has been, which projects are we going to implement. I just need to indicate, Chair, my apology. The first project, which is saying Sebokeng Rehab Center, it was a typo. It's supposed to be a Pretoria West Town's land. So instead of Sebokeng Rehab Center, it's a Pretoria West Town's land. So for that project, which is a rehab center, we have allocated 8.7 million so that we increase the number of the treatment center in the province. Then we have a Beckersdale Social Integrated Facility, whereby 2.5 million was allocated. We will be implementing a Kutso Social Integrated Facility, And then we also have Sharpeville ECD and Aged Care Center, which was allocated 2.5 million. Then we are also saying that we have allocated 9 million for the demolition and construction of Walter Sisulu CYCC. So the 9 million is not only for demolition, it is also for the construction of Walter Sisulu. Then the 5.5 million, we have an institution called Fathers Mangaliso Mokachwa CYCC. So we have allocated 5.5 million in the current financial year to refurbish that center. Then for Dr. FNF Phase 2, we also have a treatment center called Dr. FNF, whereby we, in the current financial year, the department allocated 4 million. And then we also allocated 7 million for the homeless shelter at Binoni, and then 7 million for Shanguve Secure Care Center, one-stop center. I think that will be the end of my presentation in terms of the budget vote for the Department of Social Development for the 2026-27 financial year. And the recommendation is that the portfolio committee and the members of the committee to note our presentation. Thank you.
CFO, can you go to your first slide quickly, just before I'm going to take you to the questions? So next time when you make our presentation, you make sure that you make the presentation, because it's money. Just go to the first slide quickly. And I think let it be for the, go to the first slide. I want to show you something. Okay, go to the, yes. If you look at this department, it is the Department of Social Development with more than 60% of it going to NPOs. So now, your presentation has just moved us away from the core business of this department, which is NPO, restorative, which is, I'm expecting next time when we meet, give me more presentation on social welfare. Give me more presentation on children and families, because that's where our billions goes. So let it be the last time you deviate from the main core of this business. Look at the budget. It is 2 billion, and that is what the people of Gauteng want to hear. Where is their 2 billion, which is NPO? Now you've just spoken about infrastructure, which is, when I calculate this money goes to around 80 million. So next time, just be fair with us. We want to know where that money goes. 70% of this department goes there. So your presentation must concentrate on that 70%. I just wanted to correct that. Ne? Next time, I don't want to hear anything about infrastructure. I don't want to know how you are using your money for infrastructure. It's too small. I want to know where that billions goes. So, MEC, thank you very much. It's just that clarity. I think we can go to the questions now.
I think, Chair, it will be wrong of us not to clarify you on the infrastructure part that we are raising. Chair, we have a serious problem in our infrastructure. Where people are staying, I want to take you, Chair. I want to appeal to you. Can you go and visit these places that we are talking about? The rehab centers, yesterday I was at Dr. FNF. That place is rehabilitated. And we're taking people that NPOs are supposed to assist us immediately when they go out and drain them on drugs, but take them back to community, the NPOs. So there's still a link, Chair, between the infrastructure and this, and that place must be secured, Chair. You go, Chair, just here at Noordgesig, at Walter Sisulu. I know, Chair, you drive that side, Nobala. Just drive there and see. That place is insecure. And that place, it's not right, because the Children's Act forces us to make that place secured for those kids. Because those are the kids that are awaiting trials. that are under the Department of Social Development. And we cannot have that place having those children jumping out of that fence, run on top of the roof, like they did 2 months back. So which means we need, again, as much as the budget, yes, it goes on the NPOs, but we must balance with the infrastructure. Where elders are staying, you were in Tshwane, you have seen at yesterday's rest, that old age home, the conditions of that old age home. And we need to make those places better for the elders. Because if the human rights go to these places, that even these NPOs are operating, the human rights will take us up, Chair. Because we're putting people in places that are not right, that are rehabilitated, and they are saying the budget that we're giving them, it's not enough. And I'm saying to the team, as much as it's not enough, but let's have a way of assisting those places so that when you go there, you don't find our own people sitting in a bad place. Chair, if you can go to the south of Johannesburg, there are places that were built way back. They are still better as we speak today. I'm staying that side. Those facilities that elders are staying are different from the facilities that our elders are staying in the township. And to me, it's not fair. So please, Chair, don't rubbish issue infrastructure. Say to us, spend the budget properly on NPOs, but maintain this infrastructure. Have a budget from government that you don't say NPOs must maintain for themselves, because it's not going to be the standard that you expect, because they don't have enough money. Indeed, I agree. So please, Chair, I want to appeal that let's not leave this room saying infrastructure is not important. It's important, it is the same, because we're putting our own people in those facilities. But we need now to have even a leeway of us as the department, making sure that we renovate these places. They are old, they are rehabilitated, we don't have enough space. You go, Chair, to Busimu Tisakeng. If you have not been there, you will see that place, Chair. There are old buildings there that needs us to be renovating them so that we can put more people. Our list, we have more than 35,000 people that are on the list that we must take them, drain them, drugs, all sorts of things that we're supposed to do in terms of the program. So I want to appeal to the comrades, to the colleagues, let's balance, let's make our places better. You can't put elderly, I always insult them. But why do we allow these people to put elders in the places as their bathrooms, you can't go and wash? It's not right. And the security, it's not safe for them. So those are the things that we must, that's why I've said to the colleagues, it's not enough even the budget for infrastructure. But Chair, I've presented already to the next provincial treasurer. That's why I was saying to you, please help me to get money, because I will not get that money if you are saying the way that you are saying. So, but please, we are going to make sure that the money for NPOs goes to NPOs, but the NPOs must be to the level that is expected, Chair. And it's me that must do that. They can't do it with their money. As you know that it's not enough, that 1.9 billion. Thank you.
Thank you, MEC. I think you misunderstood me. I've just made a calculation. I'm saying the department has spent more than 15 minutes discussing 51 million on infrastructure. 15 to 20 minutes discussing 51 million on infrastructure. So I'm saying, if you look at the core business of this department, there is about nearly 3 billion that I wish the department can concentrate 15 minutes on the 3 billion. I am not saying infrastructure is not important. I say it could have been said in one sentence. And I will support, as this committee, we will support your way. But we want to trace the billions. We don't want to be chasing the cats while the money there. That's what we want to understand. So I agree with you 100%. Work on it, we support you, but let the department tell us, where are the billions? I want to see a presentation where the billions are categorized clearly. Where does this money go? Where does this money go? That's all I'm asking. And your infrastructure covered there, 50 billion, 50 million rand. That's what we have been discussing for 5 minutes, for 20 minutes. And I'm saying discuss 20 minutes on the billions that I want to understand. Thank you. I think now we can go to the questions.
Thank you, Chairperson. I am going to be leading the responses to the questions. I'm just waiting for the document to be loaded. Thank you very much, Chair. The first question is as follows. The department continues to experience recurring irregular expenditure and governance concerns over multiple financial years. Which programs, chief directorates, or operational areas continue to contribute most to irregular expenditure? What are the amounts involved per program, and what consequence management actions have been implemented against responsible officials? Chairperson, I'm just going to go through the irregular expenditure as per the years that you've requested us to indicate, and we will be able to demonstrate that our irregular expenditure has been going down over time, Chairperson. If we start at 2021-2022, we have had 2 instances of irregular expenditure. They came from the program development and research and as well as administration. The actual directorates that incurred this is Sustainable Livelihood and IDMS. Chairperson would like to indicate that there were no losses suffered by the department in both instances, nor was there any fruitless expenditure incurred as a result. The determination testing is completed and to serve at a newly established Consequence Management Committee, chaired by the accounting officer. The department has taken the following corrective actions. All food items, parcels are procured strictly through SCM processes. And a panel of pre-qualified service providers has now been established for repairs and maintenance for services. If we go to 2022-2023, Chairperson, we've had 2 instances of irregular expenditure. There was an amount of 9 million, which came from the social welfare services as well as administration. In particular, it came from an institution as well as IDMS. No losses were suffered by the department in both instances, nor was there any fruitless expenditure incurred as a result. The determination testing is completed and is to serve at the newly established Departmental Consequence Management Committee, which is chaired by the accounting officer. The department has taken the following steps as a corrective measure. A pre-qualified list of service providers has been established for repairs and maintenance services since 2023-2024. Invoices only received and processed at month end to prevent prepayment before the month is concluded. In terms of 2023-2024, Chairperson, we incurred 12,045,642 rands in terms of irregular expenditure, and this came from the following programs: children and families, development and research, as well as administration. The actual directorates that gave us that irregular expenditure is special needs and services to families, sustainable livelihoods, corridor, human resources management. Chairperson, no losses were suffered by the department in both instances, nor was there any fruitless expenditure incurred as a result. The determination testing is completed and to serve at the newly established Consequence Management chaired by the accounting officer. The department has also taken the following corrective steps. We have adopted a no deviations policy from 2024 to 2025 financial years, Chairperson. What is the next year? Apologies, Chair, I'm just trying to find my place. I've printed back to back, so I'm struggling to follow. If we go to 2025-2026, Chairperson, we have had the lowest irregular expenditure in the history of the department for the 2025-2026. We've only incurred 1,072,000, and this irregular expenditure has come from social welfare services, administration, restorative services, development and research, and the actual directorates that gave that expenditure is special needs and services to families, substance abuse prevention, treatment and rehabilitation services, institutions, Dr. F&F, sustainable livelihood, supply chain management, as well as directorate institutions. No losses were suffered by the department in both instances, nor was there any fruitless expenditure incurred. The determination testing is completed and is to serve at the newly established Departmental Consequence Management Committee, chaired by the accounting officer. The department has taken the following corrective steps. The tender specifications for the new school uniform tender has been revised to close any potential gaps regarding subcontracting components. A school uniform task team has been established to determine allocations to main contractors and to ensure subcontracting gaps are closed to prevent recurrence of previous challenges. Chairperson, that's where we stand in terms of the incurred irregular expenditure. And what we mean by no losses incurred, Chairperson, is that process might not have been followed by but the services did go to the relevant beneficiaries. And what the legislation instructs us to do in instances where a process has not been followed, but the services still went to the beneficiaries, is to ensure that there's consequence management. We have established a consequence management committee because it has been a concern of the committee and other oversight structures for us to improve consequence management in the Department of Social Development. Hence the establishment of that consequence management committee, which is chaired by myself as the accounting officer of the department, Chairperson. That is our response to question 1. Chairperson, in terms of officials who are implicated, the MEC has already addressed that. We did request the committee if we could maybe have an in-committee session or submit those names in writing, Chairperson. If we go to number 2, the question there is that...
Yes, I would like you to read that question.
Okay, the second question.
Yes.
Okay, thank you, Chairperson. The department previously indicated that some senior officials who were under investigations were returned to work due to prolonged investigation processes. May the department provide the committee with the number of implicated officials, their names, ranks, and areas of responsibility, the nature of allegations involved, the status of investigations, and expected timeframes for finalization. And our response there, Chair, is that given the sensitivity of giving out names of the people on a DC process that is still ongoing, we are requesting an in-committee discussion with the committee in terms of this, and I'm being guided by the MEC because we had also requested to provide a report, but MEC is guiding that that is sub judice. We may not be able to even submit the names, Chairperson.
Okay, so right, we will meet, we'll arrange MEC. We'll arrange with you, we'll meet this week because we have to have the answers. So I take it that the department said, yes, they do exist, yes, they are back, but we request an in-house meeting, and then so we can share with the committee. So the committee accept, we will meet and we'll get those names. Thank you. We can move to the next question.
Thank you very much, Chairperson, for your indulgence. Question number 3. Given the department's continued heavy reliance on NPOs for frontline service delivery, what risk mitigation measures are in place to prevent service disruptions, collapse of funded organizations, delayed payments, and instability in critical community-based programs? Our response is as followed, Chairperson. The department continues to implement the Institutional Realignment Project, which strengthens state capacity to deliver on constitutionally legislated programs and services. Some of the deliverables of the project include, amongst others, the expansion of social infrastructure programs, including implementation through hybrid models, with the intention to take over the provision of services, training and capacity buildings of social service practitioners within the department, analysis of workload management, strengthening the monitoring of NPOs. When necessary, the department will take over services from non-compliant NPOs. So basically, Chairperson, we are cognizant of the fact that a lot of our deliverables still sit with the NPOs. Hence, we initiated a process of analyzing what should come back to the department so that we strengthen the capacity of the state to deliver. And part of the work that we have begun to do is that we have turned some of our institutions into hybrid institutions where some functions sit with the department and some functions will sit with the NPOs. If I can give the example of Dr Tlou Chokoe, which is a drug rehabilitation center. There are some services that are run by an NPO there, but there are some services that are run by ourselves as the department. We've done the same with the old age homes as well. If you look at the Tembisa old age home, the Muhlakeng old age home, the NPOs provide program, we provide support services, but the intention, Chairperson, is eventually to then take over those services to ourselves. Another example is the recently established food distribution center. Albeit its challenges, what we were trying to do there again is to try and institute this program of institutional realignment program. The food banks, you will remember, were previously run by NPOs, and we have now taken over that service, Chairperson. If we go to question number 4, the department continues implementing organizational restructuring and realignment process. What informed the restructuring process? What service delivery gaps is the restructuring intended to address? And how will the department ensure that the restructuring does not negatively affect frontline services, staff stability, accountability, and institutional performance? The restructuring and realignment process was informed by the need to align the department's structure with its current mandate. Service delivery demands the generic model for provincial departments of social development and municipal requirements, demarcation requirements also informed the realignment process. It also arises from the fact that the structure approved in 2018 no longer adequately responds to workload pressures, capacity needs, funding realities, and changes in departmental functions. The restructuring is intended to address service delivery gaps such as inadequate staffing in critical areas, uneven workload distribution, misalignment between service points and municipal boundaries, increasing demand for service unfunded or redundant posts, and functional changes, including the transfer of the ECD function to the Department of Education. To ensure that the process does not negatively affect frontline services, staff stability, accountability, and institutional performance, the department is prioritizing service delivery at local level, consulting labor and employees through established structures, and strengthening reporting lines, management capacity, and alignment between functions and resources. How we protect, so we also talk about the protection of frontline services. Here, the realignment priority, strengthening service delivery capacity at local level rather than reducing it. Resources are being redirected to areas where services are rendered directly to communities. Staff stability, employees and recognized labor organizations are consulted throughout processes. Organizational structure realignment remains a standing agenda item at the Departmental Labor Forum, where issues are arising from the process are discussed and addressed. Structured consultation, a dedicated organizational structure realignment task team has been established, Chairperson. It comprises of employer and labor relations, and it has been established to guide and monitor the process. On improved accountability and performance, the proposed structure supports clearer reporting lines, better alignment between functions and budgets, and strengthened management capacity at corridor level, which will enhance corporate governance and institutional performance. On program number 2, which focuses on social welfare services, we have the following questions under older persons sub-program. The department reports only a marginal increase in services to older persons between 2025 and 2026. Chairperson, we have not conducted a needs assessment or survey to determine the number of older persons currently requiring services under Program 2 in Gauteng. However, it can be deduced from the table that we provide in the report that between 2024 and 2025 financial years, a total of 45,975 older persons have accessed services from the Department of Social Development. Of these, 12,701 have required residential care, while 33,274 accessed community-based care and support services. Every effort is made to ensure that all older persons requiring services are assisted, and necessary referrals are made in instances where the department is unable to provide the required support directly. The department has not been fully successful in responding to all older persons. That we will admit, Chairperson. But it is a function of there being limited bed capacity and resource constraints. And this is partly what the MEC spoke to with regards to availability and the standard of infrastructure in the department. But these matters are being addressed. So the demand for such services often exceeds the available bed capacity, resulting in some individuals being placed on waiting lists. However, the department has responded to all known cases requiring access to community-based programs, achieving 100% coverage of such services. Chairperson, there's just a table below that talks to the number of older persons that we have reached, and we are looking at the years 24-25, 25-26, 26-27. If we look at number of older persons accessing residential facilities, we achieved 6,390 in 24-25. 25-26, we achieved 6,311. And if we combine for these two financial years, we then achieved 12,701. And we are projecting, or the target we've set for ourselves is for 26-27 is 6,184, which if looked at MTF period of 24 to 27, we will reach about 18,885 older persons in terms of access to residential facilities. The number of older persons accessing community-based support services, Chairperson, we are indicating in 24-25, there was 16,416. 25-26, there was 16,858. And for the two combined years, then we got 33,274. The target for 26-27 is 16,858, Chairperson. And over a 3-year period, this will give us 50,132. So, Chairperson, if we look at the services for older persons that we have provided in 24 to 26, it's 45,975. And if we add the projection for 26-27 over the MTF, we would have reached 69,017 older persons with our programs. The next question is how many older persons in Gauteng require services under Program 2? Chairperson, we haven't done a survey to look at how many people require, but we have set a target for ourselves, and that's what we're able to speak to. So we've set the targets below for services to older persons, 6,146 older persons for admission to residential facilities, 16,199 older persons to access community-based services. The department's target is informed by the registered capacity of residential facilities for older persons in our province. So that's how we have set our target. What percentage of this need is currently being met through funded facilities and community-based programs? The targets for older persons admitted to residential facilities and those accessing community-based services were both exceeded in 2025 and 26 financial year due to our Section 5F interventions. In terms of question number 6, given the reduction in capital expenditure from 18.6 million to 15.1 million, can the department confirm whether existing residential and community facilities for older persons are sufficient and fully functional across all regions? If so, what assessments support this? Chairperson, there was a reprioritization of capital expenditure to refocus on maintenance of existing state-run facilities for older persons. I think that when MEC was expanding on infrastructure, it's important to note that, yes, indeed, our infrastructure is heavily underfunded. In fact, if you analyze our budget, the majority of what we have under infrastructure is not for new facilities. It's money that we use to refurbish or improve the facilities that we already have. But we are already in discussions with the Department of Treasury. We approached them quite early, Chairperson, in preparation for the budget adjustment in November, to say that there is a great need for some of our services, but a limited capacity, especially for residential facilities. Chairperson, in terms of the residential facilities that are registered and funded by the department, we are saying that they are fully functional. However, they are not sufficient to meet the growing demand for facilities for older persons. We do conduct regular monitoring of these facilities in terms of capacity, bed occupancy, and waiting lists. Chairperson, the next question is around persons with disabilities sub-program. The APP shows a decline in the number of persons with disabilities accessing residential care from 1,703 to 1,426. What are the reasons for this decline, and how will the department ensure that access to residential care is not reduced for this vulnerable group? The target in this area has declined over time due to reclassification of older persons with disabilities who were not covered by the TID. And what we mean by this, Chairperson, is that the law reclassifies older persons who turn, is it 60? I'm looking at the manager who's responsible for this program, and I can't see them. But I know that, Chairperson, when they reach a particular age, they then become classified as older persons and no longer as people with disabilities. So you can have an institution that has 700 people with disabilities, for an example, and of those, if 50 of those 700 turn 60 during that financial year, it then minuses the number because now they are reclassified as older persons and no longer as people with disabilities. So the target in this area has experienced a decline due to this reclassification of people with disabilities who were not covered by the TID. The other reason is the reduced number of funded NPOs in this area, Chairperson. And the reason for this is non-compliance with municipal bylaws. Persons with disabilities who require residential care are admitted in the available facilities. 1,703 from the final 26-27 APP remained unchanged in anticipation of demand, and this is the target that we did not change due to the anticipation of demand for such services and to ensure that more vulnerable groups access the residential care facilities within the department's limited resources. The department will continue to engage Treasury and strategic partners for additional resources to ensure that we increase access to residential facilities. Given that the services in protective workshops remain largely unchanged, how is the department planning to expand or improve access to economic and social support services for persons with disabilities, particularly in a growing population? The performance of some protective workshops was affected by non-compliance with municipal bylaws. However, the planned targets were exceeded due to additional workshops that complied with funding requirements. The Sustainable Livelihoods Directorate has been engaged to introduce additional programs that can be rolled out and supported within government-funded protective workshops across the corridors. Question number 9. It is alleged through findings of various independent verification processes of the committee that Gauteng does not have sufficient specialized facilities to accommodate older persons with disabilities. As a result, some NPOs may be accommodating such individuals outside of their approved scope, while the limited available government-owned facilities are reportedly operating at full capacity. Chairperson, as indicated, we do not have facilities that are specifically for older persons with disabilities. We have facilities for people with disabilities. Once people with disabilities are recategorized or turn 60 within that, they remain there. We do not change them. We do not move them to a different facilities. Even as they are reclassified, they remain within that facility. The primary scope of need of these beneficiaries is for services for persons with disabilities. Can the department provide clarity on the current capacity of specialized residential facilities for older persons with disabilities in Gauteng, including the number of available bed, waiting lists, and plans in place to address this gap? As mentioned, Chairperson, there are no separate beds that are specifically reserved for older persons with disabilities. They remain in residential facilities for people with disabilities. They form part of the total service recipients in residential facilities for people with disabilities. The next question is, what guidance or interim measures has the department put in place to support organizations that are currently managing such cases due to the shortage of appropriate placement? And we are saying here, beneficiaries with disabilities remain within residential facilities for persons with disabilities and continue to receive services even if they are reclassified or they are over 60. Chairperson, on the HIV/AIDS sub-program, the department plans to increase behavioral program beneficiaries from 721,510 to 1,025,365. What additional resources, financial, human, and operational, have been allocated to support this significant increase in targets? Chairperson, we've adopted a revised service delivery model here, including the use of digital platforms, traditional media, to access or to reach or attract a higher number of beneficiaries as part of implementing our prevention programs. Stakeholders have raised concerns about funding instability, compliance challenges, and closure of drop-in centers. How many NPOs are currently funded under HIV and AIDS program? How many are targeted for funding in 26-27? And what measures are in place to ensure funding stability and continuity of service? Chairperson, the total number of funded organizations under HIV and AIDS sub-program is 242. Of these, 177 are home community-based care, HCBC organizations. 56 are drop-in centers, and 9 are organizations implementing social behavior and change programs. The department funds organizations according to the number of applications received, assessed, and recommended on the basis of meeting funding requirements. The department monitors the compliance of organizations throughout the financial year, and support is provided where there is a need for improvement. Given that Program 2 relies heavily on NPOs for service delivery, and noting the previous reduction in funded organizations due to non-compliance, what specific mechanisms are in place to assist NPOs with compliance? What specific support mechanisms are in place to assist these NPOs to meet compliance requirements rather than being defunded? We are saying here there are ongoing efforts to support NPOs in complying with applicable requirements. This includes capacity building, facilitation of meetings between relevant organizations and environmental health practitioners, as well as advocacy for review of bylaws that negatively impact on the work of drop-in centers. Chairperson, we are giving an example here because the municipalities have different bylaws for all these services. We are giving an example where we were invited by the city of Ekurhuleni to make inputs on their reviewing of issuing of health certificates to health inspection reports. We made this input because we were quite conscious of the fact that we are servicing NPOs. We have also established structures and continuous engagements with the Department of Justice to fast-track the vetting of process against National Register for Sex Offenders for staff and board members of organizations. There are ongoing capacity building initiatives offered to the Department of Social Development and funded NPOs, particularly the NRSO. Monitoring is conducted continuously to ensure that organizational compliance and the necessary support is provided throughout the financial year. Chairperson, I also do want to expand a little bit on this issue of the NRSO because it was a big problem last year. The NRSO is the National Register for Sex Offenders that all NPOs that work with vulnerable persons, the individuals must be vetted against that register. We intervened by engaging the National Department of Justice to projectize the requests from our NPOs. So we have a structured relationship with the Provincial Department of Justice. They have over 79,000 backlogs in terms of vetting. And we said that because it affects our processes of approving funding, can they just expedite those applications that come from us? So last year, for example, we were working with both the National Department of Justice as well as the provincial to expedite those, Chairperson. So we do intervene on behalf of NPOs to assist with compliance. Chairperson, on program 3, which deals with children and families, care and support services to families, the question is, what measures are in place to address previous operational challenges affecting homelessness and reunification services? And has the department developed a sustainable long-term strategy for homelessness and reintegration services? The response is that the department has implemented a range of corrective interventions to address previously identified operational challenges affecting homelessness and reunification services. The establishment and regular convening of homelessness workstream to improve interdepartmental coordination. That workstream, Chairperson, sits on a weekly basis. It comprises of multi-departmental stakeholders to discuss issues affecting homelessness programs of both the provincial government as well as at the municipal level. We also have active engagement and collaboration with municipalities and NPOs. The department is currently reviewing its strategy towards a more integrated and sustainable approach to homelessness and reintegration. This includes coordination with the Department of Human Settlements to address housing needs. And I must mention that the Department of Human Settlements is part of our homelessness workstream that sits on a weekly basis. The Department of Health to manage issues of mental health challenges, which often affect homeless people. Municipalities to address bylaw-related issues. To strengthen collaboration and partnerships, the department is in the process of entering into a memorandum of understanding with all relevant stakeholders. On children care and protection services, given that the finalization of foster care orders depends significantly on court processes, what evidence does the department have that the increased foster care targets are achievable? And how is current operational performance informing these projections? The department, there's been no increase in the targets for foster care in the 26-27 APP. The target is 33,755 children with valid foster care orders remains unchanged. To ensure the attainment of the maintained target, the department is in the process of transitioning child and youth care centers with children under 6 into cluster foster care schemes. The department is closely managing the non-reporting of foster care data by a child protection organization. The department is also project managing the issuing of all Section 176 orders within the last quarter of the financial year. On child and youth care centers, while transfers to NPO-operated child and youth care centers increase in 26-27, the overall CYCC program allocation and placement targets decline. What factors informed these reductions, and how will the department ensure that vulnerable children requiring alternative care services are not adversely affected by declining placement and reunification targets? Our response is that the 25-26 targets of 4,318 for CYCCs included Mabuto Tlajwayo, which has since been repurposed as an inpatient treatment center. Targets for children's homes and places of safety remain unchanged. Community-based care services for children, the budget allocation for community-based care services for children increased significantly in 26-27, and yet the number of children reached remain unchanged in short term. How will the increased allocation improve service delivery outcomes and strengthen prevention and early intervention services at community level? Our response is as follows. The budget allocation for community-based care services during the year under review was mainly utilized to employ additional auxiliary child and youth care workers who are at the forefront of providing prevention and early intervention services to vulnerable children. This will result in an increase in the number of personnel implementing prevention and early intervention services, thereby enabling more beneficiaries to be reached. In the medium to long term, the quality of services and support provided to vulnerable children will be strengthened, leading to an improved quality of life. What specific service improvements, the program expansion or organizational labor interventions will be implemented through additional funding, and how will these improvements be measured? As indicated above, the budget allocation for community-based care services is primarily utilized for the employment of additional child and youth care workers. The additional funding and increased personnel will improve the early identification of vulnerable children and ensure that necessary support is provided to address the psychosocial needs of beneficiaries. Implementing organizations are expected to submit monthly statistics on the number of beneficiaries reached. Improvement will be measured quarterly against the number of beneficiaries reached in relation to the set targets for the community-based services performance indicator. Chairperson, we move to program 4, which is on restorative services, and the questions are particularly around victim empowerment. Consider, why do targets for sheltering services and empowerment programs decline in 26-27 despite the department's stated commitment to supporting GBV victims and related services? And our response is as follows. There's been a decline in available shelters, Chairperson, due to various reasons. These include voluntary closure of shelters, suspension due to forensic audit findings, mismanagement of funds, and non-compliance with municipal bylaws. The beneficiaries are not left stranded, however. They are transferred to suitable shelters in terms of their needs. The target of 2,098 for sheltering services remained unchanged to ensure access to these services given the level of need and the department's commitment to the program. Despite some NPOs being affected by non-compliance with municipal bylaws, the department has met all its VEP targets except for sheltering indicators, which are affected by the factors that I've mentioned above. How will this sub-program ensure that adequate access to shelters and empowerment services for victims given the reduction in planned output? The department has planned to raise awareness through radio stations, social media, and increased awareness campaigns. The department will also capacitate victim supporters across all corridors to align their NPO's 365-day plans of activism, GBV, and enhance awareness of the shelter program within the respective communities and spaces. The program has also collaborated with the departmental psychologists who will assist in developing GBV program and training social workers to deliver empowerment programs. On substance abuse, Chairperson, prevention and rehabilitation, the question being asked is the increased allocation is not translating into expanded treatment aftercare or reintegration services, particularly in the context of reduced NPO funding. How will the sub-program expand treatment and rehabilitation when services when transfers to NPOs are decreasing and key targets such as aftercare and halfway houses admissions are not improving? Our response here is that the department continues to make efforts to expand access to treatment, aftercare, and reintegration. The department has expanded bed capacity in 3 funded inpatient treatment care centers, established a new day clinic, and funded 3 halfway houses. Furthermore, the department has also resolved to repurpose its two of its child and youth care centers into treatment facilities for substance abuse. The department also funded boot camps to strengthen aftercare and reintegration services. In terms of treatment, the following initiatives have been implemented by the department to increase bed capacity. Dr. Fabian and Florence Ribeiro Treatment Center was refurbished, increasing bed capacity from 353 to 501. The refurbishment has been completed. Further, Simangaliso Mkachwa CYCC has also been repurposed and refurbished into a treatment care center, and plans to operationalize the facility are underway. Mabuto Tlajwayo CYCC has been repurposed into treatment care center with 110 beds and is currently operational. The Tladi Walk-in Center was also expanded from walk-in center into a day clinic, offering day detox services and serving approximately 150 service users per month. The facility includes a fully equipped day detox ward. The department has taken a resolution to establish walk-in centers at its various social integrated facilities to provide comprehensive treatment services, including day detox ward and skills training. In terms of aftercare, to strengthen the aftercare program, the department is implementing an aftercare bootcamp program aimed at preventing relapse. This program was introduced in Q4 of the 25-26 financial year and has to date shown positive progress, with most service users demonstrating a keen interest in participating. Feedback from participating services users indicates that the program has been beneficial. However, a formal evaluation of the program will be conducted within the 26-27 financial year. A total of 900 service users attended and completed the aftercare bootcamp and are now participating in various skills programs within communities and in halfway houses. What corrective measures has the department implemented since the previous financial year to address NPO-related service delivery constraints? We are saying here, Chair, the following efforts were undertaken by the department to address NPO service delivery constraints. We've strengthened monitoring of NPO performance through monthly performance review meetings held from Q4, focusing on individual NPO performance and the development of mitigation plans. Provision of training capacity building and support to NPO specialized programs such as IKULE, Universal Prevention Curriculum, and Fetal Alcohol Syndrome, among others. We've reviewed the funding framework to reduce the pressure on NPOs and align funding with the basket of services, aligned service level agreements with approved targets. We've established state-run facilities, including inpatient treatment centers and day clinics, to address service delivery gaps. We've funded aftercare bootcamp programs to strengthen aftercare program. We've increased bed capacity in halfway houses from 82 at the beginning of 25-26 financial year to 468 in the 26-27 financial year. Increased overall provincial bed capacity from 684 beds available for drug rehabilitation inpatient treatment to 1,157 in the financial year 2026-27 financial year. We've registered and funded 3 new halfway houses and expanded bed capacity in 1 existing facility by an additional 10 beds in Q3 of the 25-26 financial year. The last program, Chair, which is Program 5, Development and Research. The question is, how many funded NPOs have been integrated into departmental procurement or service supply arrangements, and to what extent are the products developed through funded livelihood programs utilized within the departmental institutions? The response is that the department does not integrate NPOs into procurement or service supply arrangement, as NPOs are non-profit organizations and are not permitted to generate profit in terms of the NPO Act, Chapter 1, Section 1.1X, A and B, as well as Section 12.2C. The purpose of NPOs must be non-profit, and their surplus must be used to further the organization's stated public objectives. What measures are in place to support product certification and compliance processes? We are referring to question 24, as we've indicated that NPOs are not supposed to, they are not permitted to generate profit. If we go to question 26, what is the number of beneficiaries successfully transitioning from welfare support into sustainable economic participation within the financial year? In the 25-26 financial year, 20,917 beneficiaries participated in the department's Welfare to Work program. The program is aimed at developing functional skills, fostering workplace readiness, and building competencies of participants. Some participants are encouraged to establish small businesses or cooperatives, enabling them to earn a sustainable income and create employment opportunities for others. Chairperson, on transfers to NPOs, macro budget oversight, why are several key service delivery targets declining despite increased budget allocations across programs, including victim empowerment, sheltering declining by 58%, substance abuse admissions declining by 52%, youth skills development declining by 38%, and food relief beneficiaries declining by 16%. The decline referred to above to the proposed targets, the decline referred to above relates to the proposed targets in draft 2 of the APP that we submitted, which were subsequently either maintained or increased. So the table below then reflects the targets as per the approved 26-27 APPs. So on victim empowerment and sheltering, the target of 2,098 was maintained in line with the declaration of GBVF. Despite audited performance of 24-25 being 1,290, the target 2025-26 was almost doubled by 2,098 and has since been maintained. On substance abuse, we're saying the target on the number of service users who accessed substance use disorder treatment services has increased from 50,030 in 25-26 to 52,283 in 26-27. Youth skills development, the target of 50,000 on youth is solely for youth beneficiaries. However, the umbrella target, which is the number of welfare vulnerable persons participating in skills development programs, was increased from 83,339 to 87,090. In terms of food relief beneficiaries, the number of beneficiaries accessing food relief programs was aligned to the budget allocation and the delivery agreement. A reduction was realized in the 25-26 financial year through the retabling of the APP as a result of inadequate number of beneficiaries receiving daily meals at HCBC's organizations, which is one of the indicators contributing to this program. The next question, Chairperson, is why is increased funding not translating into expanded reach to vulnerable beneficiaries and communities? And what program by program explanation can the department provide for the continued decline in planned output and beneficiaries reach across the services? And we are saying the department did not reduce the targets under review for the financial year, and therefore there's no decrease in the number of beneficiaries reached. Why does the department continue to rely heavily on NPOs as frontline service delivery, despite ongoing operational instability, compliance pressures, governance challenges, and sustainability concerns within the NPO sector? Chairperson, this question is similar to question 3 and 4, and we've responded to it, and therefore we are referring back to our responses in question 3 and 4, which also talks to issues of realignment and hybrid models and improving the capacity of the state to deliver services. Further, what measures are in place to prevent possible service disruptions, or what has been referred to as silent service delivery collapse within funded NPOs? There is no silent service delivery collapse. There's no silent service delivery collapse within funded NPOs. The department has funded and paid the first quarter tranche, and progress is detailed in Annexure B. There is an Annexure B on the funding of NPOs during the year under review, Chairperson. Additionally, the department continues to engage municipalities on issues relating to municipal compliance and other matters that are beyond the control of NPOs. This is aimed at ensuring consistent service delivery to citizens, to the residents of Gauteng. Why is the department unable to provide comprehensive, transparent account of funded NPOs, including organizations, names, contact details, locations, corridors, funding or locations, contracted service delivery outputs, and service delivery agreements? Chairperson, the department is in the process of developing an NPO funding policy, which will address all these issues that are raised above by the committee. The department is currently operating under the guidelines issued by the National DSD as an interim measure. The next question is, how does the department monitor, verify, and evaluate whether funded NPOs are achieving the outputs and service delivery obligations for which public funds are allocated? And our response is as follows. All NPOs are monitored using the program monitoring tool and the financial monitoring tool. This ensures that the quality of services rendered to beneficiaries is assessed alongside the achievement of set targets. Financial monitoring also assesses whether the funds allocated by the department are utilized in accordance with service level agreements by the NPOs. This ensures full accountability in both service delivery beneficiaries and financial management. Question number 30. Over the past 3 financial years, how many NPOs have been supported by or capacitated by the department? Please provide the names of the NPOs, their contact details, and the corridor district location and the type of capacitation or training provided, the specific courses attended, the number of beneficiaries supported, and the budget utilized per financial year of these interventions. Our response is that the department has consistently achieved its target for the training of NPOs over the past 3 financial years. A total of 4,050 NPOs have been capacitated during this period. The breakdown is as follows. In 23-24, we capacitated 1,200 NPOs. In 24-25, we capacitated 1,250 NPOs. In 25-26, we capacitated 1,600 NPOs. Registers serving as evidence of training conducted with NPOs over the past 3 financial years have been archived by the provincial government. We are therefore requesting the indulgence of the committee in granting us extension of time in order to collate the vast amount of documents which spans over 3 years to be able to submit these to the committee. What is the latest status regarding the signing of SLAs, the number of NPOs already contracted, organizations identified, appeals, dates for said appeals, and payment of first tranches? Chairperson, what I will be responding to here is as at 25 May 2026. There definitely has been progress to date. So I will mention this corridor by corridor. So if we go according to corridors, let's just start with the central corridor, which is Johannesburg. We have signed 349 SLAs. Number of SLAs processed for payment is 348. Number of SLAs that have been paid to date is 337. For the Eastern Corridor, we have signed 323 SLAs. We have processed for payment 317 SLAs. We have paid 273. For the Northern Corridor, we have signed 218 SLAs. We have paid 215 SLAs. We have processed for payment 215, and money in the bank is 470. In terms of NPOs that are managed at provincial level, not in corridors, we have 37 SLAs that have been signed. We have processed for payment 37, money in the bank is for 29 SLAs, those that have been paid. In the Southern Corridor, which is CDB, we have signed 179 SLAs. We have processed for payment 179 SLAs, and 155 SLAs have been paid, money in the bank. Western Corridor, we have signed 201 SLAs. We have processed for payment 201 SLAs, and we have paid 183 SLAs, that is money in the bank. Our grand total, Chairperson, we have signed 1,307 SLAs as at 25 May. We have processed for payment 1,297. We have paid money in the bank 1,147 NPOs. The department has commenced with appeals. This is, as at last week, we had commenced with the planning process for appeals, during which the administration of appeals has been established. The consolidation of the number of total appeals has not yet been finalized, as we continue to receive appeals even as we sit here, Chairperson. NPOs are still sending us appeals. We have not closed for appeals, but we have started with the process of considering appeals. The consolidation of the total number of appeals has not yet been finalized, and once completed, the department will respond to the committee. The expected date for completion of this process is 30 June 2026. Why is the development and research program, which houses poverty alleviation and youth interventions, declining by approximately 22.4 million despite worsening socio-economic conditions, unemployment, poverty, and vulnerability levels within the Gauteng province? Our response is as follows. In the previous financial year, the department made an adjustment by allocating additional funds to the development and research program during the budget adjustment process, increasing the allocation from 254 million to 306 million. In 2026-27 financial year, the department reverted to the baseline allocation of 25-26 financial year prior to the adjustment, with only a slight increase from Treasury. This is why there appears to be a decline in the funding. What intervention is the new MEC implementing to address inherited governance weaknesses, operational challenges, funding instability, service delivery pressures within the department and its funded entities? The department has commenced initiating the funding processes earlier for 27-28 financial year to ensure that the delays related to NPO funding, which sometimes causes instability within the sector, are eliminated. Chairperson, we don't have an exact date yet for the committee, but we will be sending out the advert earlier than we did last year to avoid these delays. The department believes that starting the process early will reduce operational challenges and alleviate service delivery pressures. The department intends to also fill the critical vacancies within NPO Partnership Directorate to strengthen leadership and ensure stability. The committee might be aware that we are currently operating with an acting director, but we, over the weekend and last week, we advertised the post and we are intending to fill the post as soon as possible so that there is stability there. How will the department ensure that increases in budget allocations translate into measurable improvement in frontline service delivery outcomes, particularly in areas where targets remain stagnant or decline despite additional funding? The department will ensure that there is an increase in targets where there is additional allocation. Furthermore, through the research unit, the department will commission impact studies to investigate the value add of budget increase. Given the department's continued reliance on NPOs to implement critical social welfare, Chairperson, this again is similar to our response in number 3, number 4, and I think number 28. What are the key institutional, financial, and service delivery risks identified by the department for the 26-27 financial year? And what mitigation measures are in place to prevent these risks from negatively affecting vulnerable beneficiaries and frontline? I'm just looking for the annex chairperson, but we do have a risk register that we regularly monitor. To
Just
ensure-
flight that annexure C.
May I then say, refer to annexure C, chairperson, or do you want me to read through it?
Flight it there.
Chairperson, I didn't hear you.
Flight that annexure C for us
Okay.
and take us through.
Thank you, Chairperson. It's being flighted, but if I may just start going through it whilst it's being flighted. In terms of the risk management tool that we utilize, we say on corporate services, risk number 1 is inadequate capacity to implement constitutionally mandated services. We view that as a high risk, chairperson, and how we manage this risk is to ensure that there is approval of the priority post-filling plan. There is procurement of tools of trade, and we continue with training and capacity programs, implementation of priority post-filling plan, corrective punitive measures against non-compliant NPOs. Chairperson, just to expand a little bit on this issue of capacity, we do have some constraints in terms of COE across the province. There has been a decision taken by the Executive Council to manage the ratio between the delivery of services and compensation of employees. There was a Circular 49 that put stringent measures in place before post-filling about 2 years ago, and the Gauteng provincial government decided to continue with that method. So what we are required to do every year is to submit to Treasury the critical posts that we would want to fill, and the post-filling plan is then approved between ourselves, Treasury, and the Office of the Premier. So we monitor this quite closely to address issues of inadequate capacity. Budgetary constraints to achieve on departmental mandated program. Chairperson, we continue to request for additional funding to address the constitutionally mandated priorities. You would note that we were allocated some additional funding in last year's adjustment, and even this year we have taken a preemptive stance of approaching Treasury before we even get close to the process of MTech and the processes that we follow to request budget. We are readily making preparations and submitting plans to Treasury before we go to the Premier's Budget Committee to supplement our shortfalls. The next identified risk, chairperson, is the sustainability of our funding model. Chairperson, we are saying here we are reviewing the existing costing models. In fact, we have a reviewed costing framework which we just couldn't implement in the current financial year due to budget constraint, but we are quite conscious of the fact that our costing framework for funding NPOs does need a review. We are also, chairperson, reviewing and putting in place a policy for the funding. We're also training NPOs on sourcing of private funders. This is an issue, chairperson, that we are discussing even at the level of heads of departments for social development across the country. It was an agenda item in our meeting with the acting DG of the National Department of Social Development to say, how do we assist NPOs not just to rely on DSD, but to also source funding from other possible funding sources. Chairperson, another risk we have identified is increasing litigation by NPOs. Our area of work is quite litigious, Chairperson. And what we are doing is we are doing capacity building, awareness on processes, requirements in the department that aim to address the gaps in expectations from NPOs. We also are looking into targeted media complaints, internal, external, and media releases to NPOs to keep them informed of our policy changes. In terms of Program 2, social welfare services, we have identified the following risk: limited care and support for persons with disabilities. We are again in this area reviewing the funding model for NGOs dealing with persons living with disabilities. We also have specific targeted training to address the challenges found through M&E processes for both government and NPOs. Risk number 9, Chairperson. Risk number 8, sorry, my risk register, Chairperson, is printed back to back, so I got lost there. On risk number 7, rather, we also are identifying limited care and support for homeless persons. And to address this risk, we did mention earlier on that we have a multi-stakeholder work stream that sits on a weekly basis to address issues affecting the program of homelessness. Just by way of example, Chairperson, one of the risks we've identified there is lack of uniform bylaws on homelessness. In fact, some municipalities lack bylaws on homelessness. I think it's City of Tshwane, eThekwini, and Cape Town that have bylaws for homelessness. And we are engaging municipalities such as Johannesburg, Ekurhuleni, and our other district municipalities to say that we need to develop bylaws that will govern how we work on issues of homelessness. And by the way, Chairperson, I think we are the only province that has elevated the program of homelessness to the level of the province. When I go to the meetings with the HODs for DSD, I seem to be the only one who talks about a homelessness program at a provincial level. Otherwise, in other provinces, it's an urban management issue. It's governed by municipalities. But our province has deemed it fit to elevate it to provincial level. Chairperson, the other area that we've identified as a risk is the demand and high demand of substance abuse services in the province. In particular, the demand for residential facilities. What we are saying here, our mitigation is to capacitate the existing NPOs to address the additional substance abuse needs, capacitate building for government and NPOs, appoint additional staff through priority post-filling plan, expand halfway house program for recovering service users, establishment of day clinics in all corridors to improve accessibility of services. On risk number 9, Chairperson, yes, we have identified the issue of mismanagement of state funds by NPOs as a risk. And as a result, we are saying we will amplify the training and capacitation of NPOs on financial management. We will resuscitate the quarterly sector-based engagement consultations with NPOs, the departmental plan that will address staff safety when monitoring all the NPOs, strengthening the integration and streamlining of program and financial monitoring outcomes, review of existing NPO monitoring tool, capacitating of monitoring through priority post-filling plan, periodic skills capacitation of existing staff. On risk number 10, Chairperson, limitations in meeting social protection and relief program needs. Chairperson, on this one, we are saying we are leading the coordination of GCR anti-poverty strategy. We will be resuscitating the integrated war room meetings under the leadership of the MEC. We will also have joint planning and implementation of the food relief program with sector department, GDAT. And I do want to mention that when the MEC came in, she immediately identified this as a program, a priority program, and has mandated the department to develop a ward-based relief program, food relief program. Chairperson, so that is as far as risk is concerned. If we go to question number 36, what are the key institutional, financial, and service delivery risks identified by the department for 26-27? This is what I've just gone through. Sorry, I'm supposed to be on the last question, which is question 37. What risks does the department foresee arising from ongoing organizational restructuring and realignment process, particularly regarding staff morale, operational stability, accountability, and continuity of frontline service delivery? The department identified possible risks such as staff uncertainty, temporary operation disruptions, and possible gaps in accountability during the restructuring process. To reduce these risks, the process is being implemented in phased and consultative manner with labor and employees engaged through established structures. The aim is to strengthen reporting lines, improve management capacity, and protect frontline services so that service delivery continues without interruption. Chairperson, those are our responses on the vote. Thank you.
Thank you very much. MEC.
Chair, I think we will wait now for questions of clarity, with your permission, Chair.
Thank you. Honorable members and the community or the public of Gauteng, as you have seen that your committee have placed questions from the previous presentation, and those are questions that we believe it's questions that is coming from your heart. But now we might have asked the department around 36 questions as the committee. But in you do have other questions that you want to ask the department. Now, this is your opportunity to ask questions to the MEC and the HOD so that you leave this meeting being satisfied that, yes, the committee have asked our question, but we also want to ask the question. So I'm going to start with this simple side. This side. Anyone who wants to come and ask the questions? Dr. John, do we have a roving mic? But I will prefer that whoever wants to ask questions comes here in front. Yeah, I'm taking the hands this side. Number one, come in front. Once I say number one, come here. Number two, because I'm avoiding people who are going to say, I've raised my hand. Ntateke number two. Number three, I see. Follow them. It's also dim so that I see you. Gogo mo kadi brele ki amona mo. You are number 4. Yeah. Okay. Yeah. And then itamopili. Then mewa phagamang o ya kae mewaka asiko kgethi na o tsebe o number mam. All right, emisa me ha ile bo phama emisa go bona. Now you are number 5 mme ya bona matsogo a me ba mangata. Number 6 wampona. Yes, phama. Number 7, yes. That's all. So we don't have lots of hands. Yeah, I will go for the outside. Yeah. Now I'm on this side. And that you are number 1. You are number 2, me. You are number 3. You are number 4. Yeah, number 4. Number 5, Tlongwano. Gona le hand kamo? All right. Sipho nkirele 5 hands ka kontle. So lena ke le choose jeng etla le emeng kam. Ndati, etlang kam. I've got 5 hands kam. Don't come ke sa o choose because ke tlo embarrass ka re o dule fast. So I've got 5 hands kam. All right, let's start. Let's start. We don't have time. We must start, yes. Number 1 ke mmeo. Number 1 ke mmeo. Yeah. Okay, start them. Lebatlo qala ka ntate. All right, qala ka ntate, it's all right.
Sanibonani. Phakamile, organization yala Whiteville for my disability. So we've been struggling a lot for many years. So we wanted help since you guys are here. So I'm asking in behalf of it, Tina, how can we help since you guys are here? Singancedakala kanjani? Ngoba kuningi esikudingayo.
Pinda organization yakho igama lakho baba.
Phakamile, organization is a disability, no hlobo association for people with physical disabilities.
Okay, pinda igama.
Elenhlangano. It's Phakamile Khondo. Yes, GROOTP.
Okay,
It's
and then
no hlobo
igama.
association.
Yes.
No hlobo association.
Not Hlobo Association.
Yes.
All right, and you need help. Have you applied for funding?
Yes. Not yet, but
Not yet. You are going to apply next time. Okay, they've got your name, Baba. Thank you. Number 2.
Good morning, the House at Large. I just want to find out the question number 30 from Usis. Can you please repeat that question?
The question is, over the past 3 financial years, how many NPOs have been supported or capacitated by the department? Please provide the names of NPOs, their contact details and corridor district locations, the type of capacitation or training provided, the specific courses attended, the number of beneficiaries supported, and the budget utilized per financial year for these interventions.
Okay, but the question wasn't answered fully, ne? Because there are no particulars for those NPOs, and how many are they?
Mama, the department have answered. We can share with you the document.
Yes.
Remember, she was answering, so she cannot read the entire thing. Okay. So she has to come. But you are free. You can even go to the website of the committee. You are going to find the answers are there. Oh. So they have answered.
Okay.
Thank you, ma'am.
Sanibonani. Mina ndiyathetha ngumXhosa.
Thetha sana.
Igama lami ngu-Alicia Mfuleni from Kusasa Lethu Freedom Park. Alicia Mfuleni. Yebo. From Kusasa Lethu Freedom Park ne? Yebo. Mna kusise besenza i-presentation yokuqala. Kwi-budget ukuchaphazele kwabakho i-budget yama-food parcel asingawaziyo thina Kusasa Lethu. Asifumani ma-food parcel. Ngumbuzo endiwubuzayo. Le budget ibiphuma kula presentation kala sifike thetha nge-budget yama-food parcel. Sifuna ubuza thina Kusasa Lethu zange sithole asiyazi inatse kama-food parcel enkosi. government. Yeah, Anton. Ibhalisiwe. Yile sithi asifumana food parcel asifumani kutya asiyazi lesifuna uyazi thina ba iyayifumana yini imali ngoba sitye siyajima kuphakelwa abantwana besikolo uma bephuma esikolweni thina siyajima from Monday uyawuma ngoLwesine siyajima yebo ndingumamxoxo ndingujojo ndinguzikhandi ndingutiyeka.
Dumelang, nna ke Justice Opa Matega, ke tswa ko Freedom Park. Ke na le bothata bo le bong ha bo bong bo bongata. Hoba re na le di-caregiver, bana ba tsamayang ba ilo sheba monkgono mahaeng. Bonkgono ba re tjhimang le bona, ho na le bonkgono ba kulang, ba dulang mahaeng. So di-caregivers tseo dia mara ha di thole niks ha re tsebe nna lesasa lethu le a tsebahala kapa jwang na kapo lesasa lethu le entse eng ho department se ka le sheba hoba rona re a gym ha re qeta ho gyma ha re etsetswe niks ho tla jwang ho be jwalo ke kopa karabo hona mo ho tla jwang hore Freedom Park e safe so o ka reng ha e tsejwe o etsahala eng ka taba eo.
Thank you, Dr.
Karabo hodima eo
Batho wa rabo ska wa.
because of why in a caregiver there's a man lo shaba monkgono mahaeng monkgono ba re tjimang le bona ba sa kgona ho tla ko gymming ka lebaka la eng masapo everything mara ha ba nakwe ha o etswe neng Freedom Park ba tla tseba hore e entse eng sebe se feng se entsweng ke Freedom Park ke a leboha.
Ndiyanibulisa.
Yebo mama.
Siyabulela ukuthi sizonibona namhlanje. Sizozikhalela apha kuni. Ngoba masibona into zingahambi kakuhle siyaxaka ukuthi sizokhala kuphi. Basebethethile abahamba nathi nami ndilapha ekusasa lethu ejimini khona siyajima. Sijima 4 days. Asitholi kudla. Sihamba silambile. Asitholi ma-food parcel. Asitholi into nabazukulwane bethu. Sibabona bengena pha kodwa abatholi into. Ngoku namhlanje siyavuya ukuthi sizokhala pha kuni. Sinibuza ukuthi kanti nisilibele na. Siyabulela ukuthi nizi namhlanje sizobonana nani. Niyeke lento niyenzayo. Lo government khona ngoku sesibona ukuthi lo government lo kusho ukuthi akanandaba nabantu abadala ugqibela ngokuthetha pha ukuthi banaka abantwana banaka abantu abadala kodwa amandla asinako.
Thank you, Mama. What I appreciate is that the questions are relevant to the department. It's not about electricity or a burst pipe, a wardin. It's about Abogog. Thank you very much. Continue.
Okay, good day, everyone. Yeah, I don't know if my question was in one of the questions that were on the leaflet. Okay, my concern is that we have so many.
Your
children.
name and your organization.
My name is Cora Rapezwa. I'm staying in Naturena. Yeah, as a community, we have so many children that are on drugs, especially in Naturena. And we have a number that was given by the department that we need to consult to that number and we'll get assistance. When you call that number, you'll call that number, I think the whole year, given the reference and no help out of that, you will be told that a social worker will call you and still call a number of times, but no social worker will call you. And we're still facing that same challenge. And we do not know where to take the children that are on drugs, because when you call like some institution, a child is being asked, do you want to go for rehab? a child will say no. Definitely that child won't go because, I mean, he's been affected by those drugs, and clearly he doesn't know whether he wants to leave them or he wants to continue taking those drugs. So we need help from the government. Let them not take the instruction from the child who has been affected by the drug because he doesn't know what is right and what is wrong. So we really need help as parents to be assisted on that. Let them take the consent from the parents because the parent is the one that sees whatever that is happening to that child. And as parents, we are suffering. We are being stressed by these children that are taking drugs. Thank you. Please help.
So you're saying, let us look at that Child Protection Act is the one that is causing us trouble. No? So we will take it forward. Thank you, Mama.
Sanibonani. Igama ubuhle wakaNkonyane. Nami ngibuye eNaturen. Ngicela nje ngizoyenza ngama-paragraph le ndaba. Elokuqala i-paragraph. eNaturen asina any facilities, asina community hall, asina clinic, asina next. I-clinic esinayo, i-mobile clinic. The women of Naturena, they organize themselves to go and ask for a clinic. So we were given a mobile clinic. Ekubeni namanje inama problems. Funeke ize Thursday and Friday. Ayizi kwezinye isikhathi kwesisikhathi kuza ngosuku olulodwa inama challenges staff ukuthi asikho or mhlambe kunama sick leave. I-wall i-space anyane esisibolekwe isonto lelia liyavuza njengoba kubanda ama-patient ayanetha akunandawo yokuhlala. Thina esingama-volunteer okunceda abo-sister bekliniki siyazithengela thina insipho yokuwasha, sizithengela ma-handy everything to clean. We buy it from our grants. Sikhiphe emaphokothweni kudala sikhala sicela ukuthi okungenani sipheni izinto zokuklina. Noma benza ama-vitals, they travel with their vitals kwi-toilet elibolekwe next door ekungesile la esontweni. So sinawo lo ma-challenges asina clinic. Okunye futhi njoba suku NPO eyathi NPO it's home-based care and career exposure. Kwiside laka home-based care siyanitha upho blanket wethu lolo siyacrocha ama blankets. I think now we have 58 blankets. We're still going on. We had 58 blankets when we come here. Back at home, they are busy crocheting. Senza ama beads, siswele imali yokuthenga ama beads, siswele imali yokuthenga iwool, siyazithengela thina. Onke lama blankets awu 58 sizithengele thina. Asizange sincedise umuntu. Uma asikaze sathola ifunding, umuntu asayina ukuthi sireporte kuye e-social development.
1 minute left.
Yes. Wasitshela ukuthi ngeke thina basifande ngoba asina service center. Base bangibuza abanye ukuthi kwenziweni ngalokho nje ngoba sifofeitha ama donations ethu asikwazi ukuyithwalela izinto esiziphiwayo somewhere ukuthi sizolungisa ngazo la. Sizenzele konke ama birthday wethu siwenzela on open space. Sidlala isoccer yethu asikwazi ukudlala iground li-gravel. I-uniform asina sihambile sakwenza i-quotation sikhona manje we are putting money together ukuthenga ijezi lethu lebhola.
Thank you, Sisi. The rest we will give them to John. Kune John la emuva uyomcelela. Thank you.
Dumelang sanibonani to the chairperson, portfolio committee, and the team and the MEC, Siabingelela, and to stakeholders. So I'm here to point out, I think,
Your name and your organization.
Askis. Ikamalamu Penwell Mahlangu. I'm a manager with Kids Care and Support Trust in Brongorspruit. So my point is a question of partnership that we as stakeholders we have ne DSD, because according to the purpose of EDSD is to alleviate poverty, reduce vulnerability and promote social equality. But I think how DSD deals with us, it actually does the opposite of that. Because when for example, mabangati bayo reprioritizer, they'll come and kill 5 NPOs to open 1. You know, they can come and take a program that has comply and take a program that serves about 300, 500 people. By send away that serves only 1. So they are not doing exactly what they are saying they are doing. I'm one of the examples. Our NPO serves about 500 kids, not mentioning the youth and the families that we take care of. And we've been with DSD for over 10 years. 1 year, we are late in submission of a business plan. They never helped us, assisted us, and wanting to understand. They just left us with 500 kids. They never even asked, what can we do to take these kids somewhere else? Or what other aid can we bring that these beneficiaries can have something? They never did that. We have 42 staff members. These people were left without a job. And they didn't even ask. We've been with them for over 10 years. They know us very well. They know our centers. They know everything. But they didn't even try to check. And it's not only the case here to Pela. It is the case of compliance. It's like a partnership here to Sisebenza Namapoisa. They are just trying to find compliances that will take us out. If there's tomorrow they can bring another compliance, and they don't care to help and say, we understand the municipality wants the bylaws. Can you as DSD, because we are partners, say our partners are struggling in these areas, how can we help them comply? They don't say how can we help them comply, they take us out. And that's how the partnership feels, net DSD. We are like, we have to dodge bullets all the time. We are not being assisted.
1 minute left.
But I wanted to say that I'm not speaking, I appreciate the funding, but I just want to share our hearts. Can the partnership be like a partnership that you help us? Even when we struggle, don't throw us away, just help us.
Thank you. We're moving this side. Come this side, because we can't be changing cameras. You are live on TV. So that is why we are saying 3 minutes. So I've taken 5 hands and I've allowed 2 hands from outside, because I understand we have people who are watching from outside. I hope you are warm wherever you are outside. So where are those 2? Yes, they must come and join. Yes, they must come. The ones that they've chosen. They're here already. Okay. Yes. But where are the others? I must see 7 people there. Why do I see 5? There is one who's not coming. Come. Yeah, give me all. Why would you see first? All right, let's start number 1. You've got 3 minutes.
Thank you. Thank you, Chair. Tibet Meshak is my name from Sidibe. I'm standing here as a man crying out for help through the Department of Social Development, and kindly understand me correctly. Meshak Mtibet. That's correct. Chairperson, I'm crying out for help as a man. I've seen the programs of social development, but what I didn't see, and I'm asking for a help, MEC Nomantu. There are men out there who are taking care of their children so that they halve this thing of children being called street children. I just need the department to have a partnership with the Department of Social, no, in fact, the Department of Social Development to have a partnership with Department of Justice and Constitutional Development by promoting the good morals of other men who are taking care of their children without the assistance of government. You don't need a budget to do that. You just need a thinking around it. And I believe it's possible, it can be done. The second aspect of this is that there are quite a number of NGOs and NPOs that are continuing doing one thing over and over again, home-based care, HIV and AIDS and stuff like that. And the department is under budget. You have said so yourself. In fact, the MEC go beyond to say that, Chairperson, we need assistance, and through you, we need more budget. Why can't you align these other NGOs? Because more or less, they are doing the same thing. Why can't you align them so that you increase their budget, so that they don't come to you making an appeal time and again? Thank you so much, Chair.
Okay, thank you. This is Rachel Shabalala from West Rand. Mine is to say, Chairperson, while we appreciate the department efforts to strengthen the state capacity, community-based organization remains first point of service for many vulnerable populations. We therefore urge the department to ensure that institutional reforms don't weaken NPOs, as it is directly linked to the well-being of communities we serve. My recommendations as an individual: subsidy payments must be paid on time and consistently. Long-term sustainability plans to be developed for community organizations. Capacity building and governance support be strengthened. NPO be treated as strategic partners rather than temporary service providers. Institutional reforms be implemented through meaningful consultation. I underline that one, consultation with the NPOs. Government continued investing in community-based organizations that have proven impact in vulnerable communities. Therefore, we also request that in other gatherings, please include municipalities so that municipal bylaws must be attended to in a holistic manner. And can we also be given an opportunity to have a paperless reporting template needed? Thank you.
Thank you very much.
Sanibonani, njani? Igama lami nguTsakane Ndlovu. Ngihlala eThembisa, ngizokhulumela abantwana base-Aftercare eNyiko Primary School. Bengisacela bandla kini nonke nisisize ngabantwana bethu base-Aftercare because abantwana bethu bayagodola, the most abanayo i-uniform, abanye bahamba ngezicathulo ezidabukile nama-food parcel because abantwana bethu abathola ukudla oku-enough. Thank you very much.
Thank you.
Dumelang, ke nna Dikeledi Mosehana, ke tswa ko Mavopane, ke dula ko Winterfeld. My concern is that the food parcels go 12 for ba bantsi, go tla di food parcels fela tse 50. So it's not enough for the grannies that side. The second question ke batla go itse gore ko ditleliniking we must have social workers. And rena le tleliniki tse pedi fela ko Mabopane tse di berekang 24 hours. Mabopane. The other question is, yes, re tsaya bana re ba isa for rehabilitation. Coming back, they go back again to the scrapyard ba go tswa happy. There's no progress. There's no follow-up. I don't know what is really going on. Ha gona le di follow-up. And then kutlile go bolelwa hape ka victim empowerment and sexual assaults. You don't have halfway houses. Tse di leng gaufi tse di ka thusang batho ba ba rape-ilweng gore ba boe be go counselwa ko teng. Ha re na le di street lights. The last one nna ke le koko ke le o mokana. Bo koko ba mo Bopane re dlala ball. So France e re invite-ile gore re o tshameka ko France ka go tloga ka di 21 tsa September go fitlhela di 29. So re ngwaletse the premier mo le chairperson email, but up to today no response. Ke a leboga.
Thank you.
Sorry mama. A re thuse ka a ke re bo koko ba gola modende. Oh. Okay. Okay, ma'am. Yeah. Yeah. Okay. No, ke a leboga. Ke re no a ke re ha re le mo yeah, ha re le mo ha re itse pila ke re. So tshwantse le re thuse le re bontshe gore no ha o batla thuso o ya kwa ha o rumile ba bang. Askis papa ne. Ke a leboga.
Dumelang, molweni. Mna ngegama ndingunonxeba Ndamane from West Rand, Merafong, Ward 22 in Gokosi. I'm the project manager of New Revelation Children's Hope. I'm standing here appreciating the partnership that we are having between us community organizations and the social development. But as organizations, so as community organizations, we are dealing with with the infected and affected, orphans and vulnerable children. So we encounter challenges when it comes to referral. In Forgeville, whenever we want to refer our cases, there is no intervention esitholayo. So besicela i-social development kube ne-intervention abayenzayo for ukuthi organization sikhone ukuthi si-refer ama-case ethu kakuhle. Number 2, the issue of food parcels. It's a problem because of ama target ayaphakama every year, and if food parcel is droppile. You cannot cater 29 households where else in your database you are having 350 beneficiaries to service. And also on the psychosocial support, there is no way you can support abantu 500. We request the social development to revisit that. From where you are standing as social development, and you know nikeza abantu service 500. So Tina as organization, kumele siyenzeni, because at the end of the day, you need your report. You need your stats. If we underperform, ityala liba kuthi, forgetting ukuthi what you are offering to organizations is not enough. So besicela. And also, we want the social development, especially for new organizations. Siya apply as fundiwe, but after funding, there's no capacity building. After 2 years, they will come back here and Mosha Ama fund, where else there was no capacity building. You cannot fund an organization, then you fail to capacitate the organization. So we request, on behalf of community organizations, we demand, we are not requesting. Yes, let capacity building be a priority. Thank you.
Thank you.
Sanbonani, CBOs and the community.
Chairperson of Portfolio Committee, MEC and HOD. My name is Themba Mdluli from an NPO, Itemba Foundation, is based in Tsakani here in Ekurhuleni. My first bulletin says I must pass my acknowledgement to the number of SLA signed through your leadership, MEC. I'm sent by NPOs that have already signed. So they said the number is promising towards that process. They say I was sent. Now, two, my submission would be, irregardless of the number of SLAs and so forth, we would be saying the management system towards the monitoring and evaluation, and also the impact of major organizations. Have you really gone to that far to say, who are the major players who can be mentors of SLA signing, because Tom, Dick, and Harry can sign, but have they been having mentors? And are you not harming those mentors? That is another issue. Second point is NPO partnership, private funding. Some of us, we are coming, or we have been in this sector. I've been for more than 10 years now. They will know my impact. I've volunteered a 26-year-old professional in this industry. But MEC, through submission, somehow, somewhere, I've been, I'll talk about that. Right, subjected to suppression of some sort because of creativity, innovation, and many other things. We are young people that have delegated not to go to the professional sector, but serve the social space with qualifications and so forth. Right, under that of funding, we are lacking departmental support because some funders, they want us to have endorsement letters from yourselves as MEC, as HODs, to say, you have the capacity, you can support and mentor 100 organizations in Gauteng. But where's the letter from MEC? Because you are speaking as an individual who is appraising your work. Second to that, NLC Lotto wanted to fund us on that program of capacity building. They said, but your substance is so strong, but where is government in the picture? So you send emails and that are never responded to. And that's why you lose private sector funding. I'm talking millions here. These NPOs that are crying here, we could have went to Lotto and gave us 100 million to capacitate them. We are professionals, we build proposals that can bring even international funding. We want expression. MEC, we want to establish a stakeholder relations in your office, where we will contribute without you paying us a stipend or something. We'll say, MEC, just a motivational letter, I went and go and fetch 100 million there. And we help our communities. Right. With that last submission, hence some of our initiatives will find double dipping. I will have a program with the department. I will go and get another sponsor because equally you don't know and appreciate the work I'm doing. My last submission.
Yes, with your 1 minute.
Agreeing the fact that NPOs are not profit-made or are not mandated or are not legislated to make profit. We are mentoring and grooming SMMEs and co-ops. Some of them I even went as far as going to DTI to buy them equipment, machinery for toilet paper manufacturing, for shoe manufacturing, but procurement in the department is nowhere to be found. We've got equipment that are workshop. Can we get to the attention of that? The tender system may it also include in the I heard you say, talking about subcontracting, may it include that. I was saying, NPOs, can you submit mentored SMMEs and co-ops that can participate in the program? We once, in Tsakani alone, we bought equipment worth 4 million rand of jersey making shoe. MEC. You can even come to that center and come and see them.
My name is Gladys Melody from Hope for Life in Atteridgeville. I'm a manager. Hope for Life. I'm the manager there. I just want to thank the time that you have allocated to call us, to engage with us as the NPOs. I'm standing here to bring the concerns that we have as the NPOs. It seems as if the partnership, there are some of officials that are not acknowledging the partnership, and the partnership is like a marriage. We are always reminded of marriage partnership, but when we married somebody, you share everything, even if the budget. You sit down and discuss with your partner the budget, the logistics and everything. So when coming to the SLA, we see it as unfair to us as the NPOs because we need to be consulted before the SLA can be drawn and discuss the previous one and engage with the inflation and the budget and the department to tell us how much do they have so that we can prioritize the items that can be included in the budget so that there should we should not have conflict or strain. It's number one that we request from social development. Number two, is about partnership, or also number two on partnership is that we plan as the organizations, but tomorrow you know you have to do this. There's no planning in the officials. They will phone you there's a clause in SLA that say the officials will visit without any notice. It's okay. But we already as the NPOs have the plans. We have weekly plans. We have monthly plans. So you can come to the organization, but I'm not there because already I have a plan. So it seems as if this is intimidating the officials when we tell them like that. The other one is the last one. In 2012, the ECPND program was initiated or adopted from KwaZulu-Natal. An organization that we volunteers to be the ECPND sites. We said we submit more of reports, but ECPND program came without administration. And then after 5 years, it ceased. Then the Department of Social Development took the program and changed it to RISIHA. So we are running RISIHA program as organizations without administration. Paperwork, ink, stationery. So we are really suffering, good people, and we are trying our level best to submit each and every month. Thank you.
Thank you very much. Honorable members, out of the questions that the department have asked, do you have any? Sese, do you have anything to say before the MEC respond? Yeah, you're covered. Okay, here.
No, thank you very much, Chair. I think most of the issues have been responded to. Safe to say that we need to stress on the issue of capacity building. And I'm sure even the capacity building, I know because of the constraints in the budgets, the department should actually ensure that they partner with other service providers that will be able to, because it's an issue that we normally ask as to, are we training NGOs? Are we giving them the necessary support and mentorship that is required? And I'm happy that even the stakeholders that are here today, they are mentioning that particular area. I think on the other issues, I'm covered adequately by the response from the department. Thank you.
Thank you very much, honorable members. Honorable MEC, I must put it clear that the department has answered all the questions, and I must really commend the comprehensive replies that I've seen. Let me also thank the community for asking relevant questions. I've seen even others stating that on question number 30 you didn't answer, and I have to rescue you that no, you have answered, I've seen it myself. But then if we go to just few issues, and you will understand why I'm going through them. On question number 9, on question number 9 and 10, let's just take number 10. Can the department provide clarity on the current capacity of specialized residential facility for older persons with disabilities in Gauteng, including the number of available beds? You know, the department has just emphasized the importance of infrastructure, which I agree with the department. But we, as the committee, we are trying to show you that here is your beneficiary that you have admitted in one of your facilities being a disabled person at the age of 20. Now that person grows to the age of 60. Now that person halahlwe. We are saying to the department, in your strategic planning, go and come up with strategy to say, what do we do with these people who have outlived even the abled people? Because when you admit them, you admitted them under the tag they are disabled. Now they are old. That is the gist of that question. Now on question number 12, the one that say the department plans to increase behavioral program beneficiaries from about 72,000 to about from 700,000 people to about 1 million. What additional resources and human operation have been allocated to support? And I see the answer from the department speaks a lot about digital. And I wanted to remind the department that don't shy away to say we need more money for that. That is why we are asking these questions, to also assist you to go and plan more. Now, on question number 14, which says, given program 2 that relies heavily on NPO for service delivery, and noting the previous reduction in funded organization due to non-compliance. Now, what specific support mechanism are in place to assist NPOs? And I can see you shied away from the capacity building. There is what we call SITAs. And I know now we've got what we call social development SITA. That is the money that is sitting there. All that is needed is your memorandum of understanding between you and the social development SITA, and they will use their own resources to come and capacitate this NPO on your behalf. That is why we are asking these questions. We're not asking these questions because we really just want to trouble you. Take, for instance, you have identified certain things and then you are saying you are experimenting them in Ekurhuleni. Now my question also is that, what were the stumbling blocks? Just raise them, 1, 2, 3. When it comes to the municipalities, this is what kills our municipality, our NPOs. We are unable to fund this NPO because the municipality says non-compliance, non-compliant. So that one, bring us as the committee to come and assist you to fight that, because your letter as the HOD that say I am, what do they call? I am giving you permission to operate even though you are not non-compliant on this one. I know they used to sign it. Condonation, something. We must support that condonation letter, and you fund that NPO. Now, the last one is this NERSO matter. Many NPOs suffered because of NERSO vetting. And in your answering, you said it is Gauteng, and you must take pride of what you have done. That you walked into the Department of Justice and say, Department of Justice, I cannot fund my people because of your NERSO. And I'm saying here, put it there that we have went up to the Department of Justice and they have kind of given us permission to say, these NPOs are not going to suffer because of NERSO. It is your achievement. You have made it. And they cannot come here and say, no, we are suffering. They can see now. They are not sitting here. They are not saying, department, thank you so much, you have helped us. But we are telling you as the committee that you have helped this NPO. That is all I wanted to share with you. Thanking you for answering our questions so nicely. Now, I didn't want to talk on this one. You have so far funded money in the bank, about 1,147. But you forgot to tell this people of Gauteng, how many NPOs have submitted their appeals? An appeal open for a particular date. You cannot say, I'm still receiving appeals even yesterday. No. That NPO knows that it has failed already. Because a letter will go, or communique will go out and say, now it's time for your appeal. You appeal from this date until this date. Now I'm expecting you to tell us that you receive so many number of NPOs that have qualified and you are processing them. And last, like you said, by the 30th of June, you will be done with them. So you must do your job. Somebody must not come and dictate to you how to do your job. Do your job, have the time frame. So that is all that we can say. And then to the people of Gauteng, we can tell you that the question of those that have investigated, we will meet with the department, we'll meet with the MEC and the HOD, and I think the CRO on Friday. The letter will come from my office, we'll find it, Honorable MEC. On Friday, we'll meet with you, and then we'll know who are these people. Thank you very much. Now, you can just clarify those that you want to clarify, and we move to the next one. Yes, MC. MEC? Yeah, I know those are small clarity seeking. You have answered many of the questions. Just those ones that you want to
ask the HOD, and some of the questions will go to TDG. Tibelo, I think this one that talks to the appeals, TDG Tibelo, I'm sure you'll handle it, because it will indicate when did we open the process and when the process have been closed, and she has been doing that process as we speak, Chair. Chair, I fully agree with yourselves with the issue of capacity. When this is the it's 2 months now in the department. I started in April, May. When I arrived in April, the first thing that I said to the colleagues in our first meeting is that we need to have capacity building programs that will reskill the NPOs, skilling and reskilling them, because some had the skills, but some need to be reskilled. So we're opening up that opportunity, Chair. It's something that is going to be done. We are reviewing our policy. I think HOD indicated that issue. Once we're done with that policy review, we're not going to wait for it, Chair. We will be doing the policy review, but we are going to start this process of capacitating of the NPOs, because indeed they need to be mentored and they need to be assisted, even if we plug them to other bigger NPOs. But we have to do something on the capacity. I picked it up myself, so that's why I'm happy that even yourselves, you raise it, and we are going to do it, Chair. Hence your questions, it's good that you are raising it. We're going to speed up that process of policy review that Soli, Chief Director Soli, is doing, so that we can start this process faster than we can, Chair. Including some of the people that are employed there, Chair, because including some that they're being attended to, because there are specific things that they must understand that they need to follow when they are there in the department, Chair. And I think I want to apologize on the relationship that we are having with yourselves. Indeed, when you have a relationship and you are working together, I always say you are an extension of government, as an extension of the department, because we are implementing things that the department is unable to implement. There is no way that then we should not take you along so that you become part of us. For the mere fact that you are getting the funds from the department, you are part of the department. Then how do we make this work? Indeed, I agree with you. One of the things that you are correct, when you have a In fact, that's what I raised it even in the crisis forum, Chair, when I met with them in Pretoria, just briefly, is that if we are going to cut your funds, there must be clear reasons why are you cutting my funds. And it must be discussed between you and me. And that must be based on the assessment that we have done. That's why we agreed when I was submitting all the SLAs to yourselves. I said, we will have quarterly meetings, quarterly reports and quarterly meetings. Those quarterly reports that you are going to do are going to help us to guide you that here you are not doing right, this is where we should be doing, and it will go with this capacitation and skills development that we're talking about, Chair. So I've already raised it to yourselves as NPOs because I picked it up that there is a loophole in this specific area. We can't just decide for you because if we are feeding 100 people, for example, Chair, then we cut 40 people and then we give you now an amount that talks to 60 people. There must be reasons why you say now I must not feed the other 40. And who is going to feed that 40 if you are cutting me? So that's why even this process, Chair, of the appeals, it's going to look into those things. Were we realistic when we're cutting your funds? Because your house that you have built or that you are renting or you are leasing, it's accommodating 100 people. Now we're reducing you with 40. Then there's something wrong, really. Then if there's something wrong, how do we make it right so that I don't struggle as an NPO after that to meet ends meet? Because abantu besazi babatyapayana bazawuza every day bazofuna ukutya bona, and you're not going to turn them back. So that's another thing, Chair, that part of the appeals is to look into those areas. Then we correct those wrongs. We want to broaden the scope, Chair, of the NPOs, that all the 500, there are 26 wards, not 29 as I've been saying in Dweni. So all the 526, IEC gave me now the right numbers because I'm dealing with IEC. 526. So all the 526, we want them to have NPOs, each ward to have an NPO. Want even at some stage, somebody was talking about integrating the services. That's where I'm leading. That there must be NPOs in every region, which are going to do centers of excellence. That this one, it's having everything there. If you run there, you find people that are homeless, you find people that have been abused, you find children that are there that are struggling, all the categories, all the legs that we have. We want even to do that. And we will do it if we bring everybody on board, like what she was saying, one of the members here was saying, why don't you integrate some of us so that we operate in one place? Then you don't struggle. If you need a social worker, the social worker is there attending to everyone in one room. And even the department operates there, but others then will be far away. They will operate in their little corners, but we have this one that we know. The other thing, Chair, that we want to review is the green door policy. That green door policy, Chair, that says run to that house immediately. That's an important policy that I want the team to open those green door policies because they are helping. It's 72-hour observation. I'm running away. My husband is beating me, but I know that next door I will hide there until they call the police. They keep me there until the department bring the social workers. They take me there then to a place, a shelter where I'll be happy. Now, as you go, I think they've surpassed by the victim empowerment centers, and those victim empowerment centers are at the police station. They are far away from the community. And the green door is just here next door. And I think, Chair, that's why I've said to the team, some of these policies that we're working, let's go back to them, because when I'm there for 2 days, there's nothing much that we are spending except lunch, dinner, lunch, breakfast, then but you counsel me, you make me feel better, that things will be fine, because even those people that are operating in the green doors, they need to be trained then, because you can't just accept, need to be trained, need to be vetted, definitely. Because I can't run, and I'm running to the same man that is an abuser, like my husband, yeah. So those are the things that we're looking into. Thank you. I will ask Pumla then to answer some of the questions that needs clarity. But thanks, Chair, and thanks to the questions that we've been given.
Thank you very much, MEC. Chair, also thank you for your guidance on some of the questions. We are putting effort in trying to answer all the questions that we receive. And those late nights are paying off. I'm looking at my officials who are complaining to me about late nights. They are actually paying off because now we're able to answer the questions. Chairperson, yes, I should have clarified actually that the number of SLAs that we have paid so far, it translates to about 85% spent. And in real numbers, we have paid 407 million rands to NPOs, which is 85% of what we are supposed to pay. We are very far from where we were last year at this time. So indeed, there are improvements, and MEC calls us to accountability sessions every Tuesday. Every corridor director accounts for SLAs that they've signed, SLAs that they've paid, and she always asks for detail on who has not been paid and why they have not been paid. Chairperson, thematically, my analysis of what is being raised today is in the main issues of capacity, issues of structured engagement, issues of strengthened engagement with NPOs. One of the things we are planning to do is to have sector engagement with NPOs. So we arrange, for example, we're going to arrange for the MEC to meet with the children's sector, to meet with NPOs that work on substance abuse, to meet with NPOs that work on disabilities, so that we are clear about specific problems or challenges that are affecting specific sectors. And therefore, Chairperson, I'm not going to read everything here, except to say those that are specific, who are requesting for help or support, we've taken note of those. We will share, we'll get the details from the committee. I think the committee coordinator has started sharing some of the details with me already. We will follow up. For example, Pagamile Grootboom, Non-Hlobo Association for the Blind, we will be following up to see how we can assist. Freedom Park, Ikusasa Letu, my understanding is that you've got multiple programs that we are funding you from. So there's a drop-off center, there's active aging, and other programs. So we will send our officials to just go and assess how and where exactly we can assist, including the Naturena Queens, Ntate Mutibedi from CDBeng. We've got our acting director for CDBeng. If I can ask him to just stand so that you can have a conversation with him after the meeting. And Tate Ramoji over there is leading CDBeng for us. So if you are still in the hall, just look for Tate Ramoji after this meeting to speak to him about the issues from there. The Nico Primary Care in Tembisa, we've got our director for the Eastern Corridor, Ms. Adele. She will be sending social workers to go and assess the situation there. Sis Nongeba, it's very interesting that you were saying there are no interventions in Fortville. Are you saying there are no social services in Fortville? We have our director here from the West Rand. She will definitely be looking into that. Luckily, you are a funded NPO. That issue you were raising about the number of food parcels that you get for the HIV/AIDS, you have 300 beneficiaries. What we've done is we've not stopped providing food parcels for HCPCs, but we have changed the delivery model. So we are no longer giving food parcels to NPOs to give to people, but we are saying you can get food parcels directly from the food distribution center. So what we need is lists of your beneficiaries, please submit those to the corridors so that they can then be sent to our sustainable livelihood colleagues who work there. Itemba Foundation, Tsakane, abantu bakambali nomshado, we, again, even there we will follow up. We are very, very much concerned when you talk about equipment that is rusting somewhere, that is not being utilized, when we are saying we are prioritizing skills development. So please do continue to talk to us. I will also be available after this. MEC, I am going to allow DDG Mkondo to talk about where they are in terms of the appeals. You are correct, Chairperson, that we should have sent communique. Our DDG for corporate services is here. Communications report to him will ensure that there is a media statement or a communique that informs members of the public that we've started with appeals. But we know that some of you have been appealing as soon as some have received the regret letters. I have been receiving a lot of letters. I am not part of the appeals committee because I'm the final arbiter. So DDG Mkondo is doing the preliminary work. If you are not happy with the outcome from them, you can then write directly to the HOD to say you are not happy with the outcome of the appeals committee. But the appeals committee is appointed in terms of our SOPs, and I will ask DDG to just quickly talk about, because we now have a sense of how many appeals we have received, and the work started yesterday, and it will run for a period of about 2 weeks until the 30th. DDG?
Afternoon. Good afternoon, Honorable Chairperson, honorable members of the committee, honorable MEC, HOD, and all community members. HOD has already, I think, touched on the appeals process that is in progress. We started yesterday formally, and we are going to end the process next week on the 19th of June. So there is a timeline that has been set that all the regret letters that has not yet been issued out. Yesterday, we gave a directive that all of them should have been issued out so that people are given 7 days. On the regret letter, it indicates that you must respond to the department within 7 days. So the 7 days is next week, Wednesday. So if you apply, you respond later than that, then it's going to be a problem. So we have received quite a number of appeals, and we have categorized them. There are those that have applied late. There are those that have sent to the wrong email address. There are those that are, disputing the amounts that they have been allocated. There are those that have been regretted by the department or not recommended by the assessment panels because of a variety of reasons, such as, if you are not registered in terms of the program and all that. So those are the issues that we are, looking at. So our appeal is that if you have received an appeal, a regret letter, please make sure that you respond within that 7 days, as it's appearing on the regret letter. Thank you very much, Chair.
Are you done, department? Are you done, department? Okay, thank you. I think, like I said, MEC, thank you so much. Thank you so much for these answers. I think as we are closing, you have seen the MEC and the HOD and the officials from the department are really answering you, the people of Gauteng. And MEC, you will realize why the committee will ask questions. I want you to also look at question number 1. You will see that question, it says to you, the department continue to experience recurring irregular expenditure and governance concern over multiple financial years. Which programs, Chief Directorate, operational areas continue to contribute most to irregular expenditure? What are the amounts involved per program, and what were consequence management? Now, I will not look at the 6th administration, but you will see at this, that's when we started in May 2024. The troublesome people or culprits, you will see that we as the committee are watching closely these sustainable and livelihoods. We are watching closely these special needs and services to families, substance abuse, and the reason why we are doing Dr. FNF, Office of the HOD, even Office of the HOD contribute to this, and the supply chain. We've always asked you about the people that you are employing. So now what I like about the energy of our MEC is that it goes deeper. It is going to be surprising when we ask you a question. Now we want to know, who are these people? That when you advertise position, they've been contributing to this loss. They apply for the position, they expect you to promote them. So we are telling you as the committee, don't appoint people that are troublesome to you. Don't appoint people that are blocking service delivery. Why appoint them? Because they are the ones that are derailing the department. Now, you mentioned in your response that there are NPOs that are litigating you. Can you believe this? So MEC, we are empowering you. If you have an NPO that has so much money to take you to court, but they claim that they are helping the vulnerable, but they've got so much money to take you to court. Look at them. Now, on the appeal, as I'm closing, that appeal committee must tell us, and we will meet again with these powerful people, I repeat, the monitoring and evaluation. We will sit down with you guys one day. You will come to the committee. Now, the NPO applies and say, I'm requesting 1,000 rand to fund me. They get a letter that say, now we are going to fund you. But surprisingly, that NPO gets a letter that, no, you needed 1,000, but the SLA says, now we're funding you 500 rand. And they are scared of you as the department. They are scared of these powerful people. Now you are NPO, hence I was looking at those billions. Now the same NPO now get an SLA to say, now come and sign. When they sign, they are no longer signing the 500. Or now the first tranche come. The first tranche that come when you are expecting 125,000, they get 50,000 rand. And they are quiet, they don't say anything. That is why one of the officials, one of the speakers say, you know, we are not in partnership, we are in an abused relationship. So MEC, look at these areas. Don't just look at appeal that I didn't get funding. Look at an appeal that says, I appeal for 1,000 rand, but I've signed for 200 rand. You know where that money goes, MEC? It is that money that goes to Treasury. So somebody's got the energy to hide the money from the department and release that money at the last month of the financial and embarrass the MEC. I will not tolerate that. So they know exactly where they are hiding money away from you. And I'm giving you a formula. I've given you a formula on the food parcel, how they are doing their thing, and we get punished by these voters here. So we are going to make you feel how legislature work. So in the legislature, we don't have what we call lunch. So I've allowed the service provider for food to give you food, but for this table, they will sit here. So don't be surprised when you get food, because we understand you have to eat, but we want to finish quickly. So we are continuing with our program, and then you will be getting food. Don't make noise. Pay attention so that you can ask questions, because now we are going to the last part of our program. The last part of our program, and I want to explain to you, The department has done its work during the financial year 25-26. Now we are meeting today with the department to tell us what they have done at the fourth quarter. So they are going to respond or make a presentation on the work that they've done from January, February, March. And then after that, the committee have sent them questions to answer, and they will answer those questions as they did with the vote. I'm sorry that this meeting of social development is different from the others. Here we are going to stay the whole day. So I want to see those that I've given them a responsibility to feed you, if they've got enough food to feed you. So I'm checking. So no one must leave here without eating. So there is no money, no food that will go back. So you're going to finish all the food today. Okay. MEC, I'm now taking it back to you to lead us on item number 7, which is presentation of the fourth quarter performance report. So I think you will say HOD lead us again. MEC?
Thanks, Chair. Thanks, Chair. Bona be restless, moko bantu abadala. Thank you, Chair. Chair, we are going to ask HOD just to go through the report, and with your permission, and then after presenting, we go through the questions as we have done in the first presentation, Chair. Thank you.
Thank you very much, Chair. CD Ndweni will lead us on the fourth quarter report presentation, and I will then take the committee through the questions.
Thank you. Good afternoon to the Chair, honorable members, Sanbonani Dumelang. The report will cover the following. As indicated, we are reporting on what the department has delivered in the fourth quarter from January until March. That's what it will cover. And then what we normally do, we want to at least indicate to the communities in terms of, and the legislature, the committee, how we've spent and what happened with the monies that we've received. I'll start with Program 1. Program 1, it's a iso ya department. Lendo City Pexelezi administration. Lapage, we have achieved 67% of what we've planned for the year. And Program 2 achieved 86% of what we've planned, with children and families achieving 73%, restorative services Program 4 achieving 76%. If you look at Program 5, which deals with poverty alleviation and sustainable livelihood, it also performed at 85%. The department overall, by the end of the financial year, managed to achieve 83% of its target. That's the overall. If you look at the next slide, you can see that from quarter 1 up until the last quarter, there has been that improvement. But the biggest improvement, I must say, it's from quarter 3, where we were at 44%, and we moved to 83%. Where were we in the last quarter of last year? You can see the department really is on the improvement drive. Program 1 last year was 63, it's at 75, it was at 75 this year. Program 2 maintained, Program 3 improved, and all the programs improved. And that meant that from last year we were at 70, we ended the year at 80%. Now, if you look at human resource, they've achieved all their targets. Supply chain, they've achieved only 66.7%, achieved between 51% to 75%.
and how we're managing the monies with at least the targets. There's about 33 which we did not plan for. And then, Hari Shabamani who program 2. Tshebedisano kapa di-programa tsa rona tse shebanang le batho ba baholo, older person, body residential care facilities, the service center. Ho mananeo ao he tsohle tse re di planning re kgonne ho finyella lenane leo le ne re le beile. Ke ka hoo e leng tala and e leng 100%. Similarly, uma ubheka lapho ku bantu ebesi funa ukuthi sibancede abakhubazekile, u50% oku half yalabo ke ebesihlose ukuthi singabapha insebenzisano zohalumeni sikhonile ukuthi sibafinyelela. Kube nje idlanzana which is half la sifikelele mhlambe kuyo le percentage engaphansi nje kwa 99%. Kubantwana ke ababhekane nale sifo se-HIV and AIDS, le insebenzisano esiphana ngazo ama-home based care, wonke ke ama-target wethu siwafinyelele kungako aku-100%. Program 3, child care and services, 80%. Lo 20% ke esingakhonanga ukuthi sithole u100% wama beneficiaries kube ama-shelter for abantu abahlala emgwaqweni phecelezi the homeless. Ngoba abanye walawo ma-shelter avaliwe phakathi konyaka, amanye wawo awakhonanga ukuthi afikelele kuzidingo ebezifuna umasipala, ngaleso hlobo ke avalwa. Child care and protection, 40% was achieved. La ku ECD and partial care lapho ke niyazi ama ECD awasekho ku social development, kodwa ukubhaliswa kwa zonke inhlangano ezinakekela abantwana kusese into esibhekane nayo. So bonke laba abacela izicelo zokubhalisa sikhonile ukubanceda ingakho iku100%. Child and youth care centers iling di poleke more beyamba na barona ka tlasa lefapha la Thekolelo. Child and youth care centers kapa tsona di children's home re kgone ho finyella kaofela dinomoro tse ne re di beile le community based care. When you look at restorative care, we've achieved under crime prevention, victim empowerment. We did not do that much well under substance abuse. This 14.3% slalo, it's areas ezihambelana neinhlelo zethu zokunceda abantwana bethu abanezidakamizwa. Kunalento ekubizwa ukuthi ay halfway house, mabaphuma kuyo bakhona ukuyohlala khona bancedwe ngamakhono, bancedwe futhi nokuthi baphiwe counseling, bangakafiki ekhaya basabuye rehab. Kubonakala ke kulonyaka ophelile weimali ukuthi u14.3% azange sifinyelele kulabo ebesifuna ukubafaka kuma halfway house ngoba inani lama halfway house acele afake isicelo ama application abe ngaphansi. Siyaqhubuzela ke ukuthi njengoba sizovula kulonyaka ozayo siyaqhubuzela umphakathi ukuthi ama halfway houses niziveze sikhona ukuthi singabi ku 14.3%. Sicela futhi sihlalo nokuthi omasipala bethu basincede ekusebenzisaneni nani njengama NPO ethu ukuze nifinyele imigomo nemibandela abayidingayo phela le okuthiwa ama compliance. Sisaqhubeka ke ukulwa nendlala, ukuphana namakhono. Uma ubuka nje la ku youth development 100% kulabo abe sifuna ukubafinyelela sifikile kubo, na ku hlelo esiphana ngalo kubo mama besimame women development empowerment we've achieved. Sinayo futhi le program ye population policy and promotion lapho ke sibhekana nokuthi bangakhi abantu abakhubazekile, bangakhi abogogo, bangakhi kanjalo and all that. So all those targets were also achieved. Seke sakhe ama ECD noma sakhe indawo efana nale holo kodwa esibizwa ngokuthi ama social integrated facilities. These are facilities that we build so that you as the community can access the Bantu Bonke. It's done. And then Beggesdal Social Integrated Facility, it's almost done now. Kusashota lapho nalapho. Uma sibheka ke ukuthi u-AG okuwuye phela obheka ukuthi sisebenzisa imali kanjani, incwadi zethu ngabe zihamba kahle, ngabe asikhulumi namanga masilokhu sithi 100% kanti asikhulumi zona. Basithumele ke icelo ezingaba amashumi nesithupha 16 kulezo saphendula kweshumi nanhlanu 15 okusho ukuthi bazasitshela ke ukuthi leko esinitshele kona kuyiqiniso noma kanjani. So we have AG that looking over our report. Kube neke nenhlangano ebitwa Public Service Commission elinyo netsebenzisela nglohore tsamaiso ka kakaretso ya lefapha la thekolohello e tsamaya jwang. Ho bontsha hore bo ka boholwanyana dintho ntse di tsamaya hantle ka tlasa administration kapa tsamaiso. Public Service Commission ha ya kopa letho ka fourth quarter ho bontshang hore dintho di beterenyana. Chair, I won't spend much time here, but safe to say, on the numbers that we report, we also do that disaggregation. From the 403,000 that we've reached in the fourth quarter, it can be seen that about 103,000 were males and females were about 175,000. Similarly, from the 365 days of activism, the 1 million that we've reached, we're showing that disaggregation, etc. Similarly, if you look at our fight on substance abuse, over 2 million have been reached, and of that 2 million, 21% kube abantu besilisa and abantu babomama ke kwaba yi 23%. Similarly, with people with disability of the 4.5 million, we are saying about close to about 35% were males. And with persons, services to older person of the 1 million that we've reached, we can see that abogogo were at least 5%. Abomkhulu ke kuwo wonke ama uhlelo lwethu la bantu abadala bahlala ba less, hence it's at 3%. We also reporting on the 3 priorities. These were the challenges that we came across: lack of specialized programs within the child and youth care centers. We've established a committee to look into that. Uma sibheka lapha kulohlelo lethu lo APWP eliphana ngamakhono, siyaqhubeka ke sithi kunengqingaba ezenza ukuthi mhlambe singabi nemali yanele ukuthi siphane ngamakhono. So esikuhlongozayo recommendation ukuthi u5% wale mali esitholayo siyacela bandla ku umbuso wakazwelonke national basiphe at least 5% sikhona ukukhuphula amakhono. There were no requests from the legislature, and these are just the areas where we did not do well. On the GBV, the areas that we did not do well and the reason for division will be the NPO that's closed down. And under procurement spend, we also did not reach the target. We only reached at least actual was 28%. And the people with disabilities accessing procurement spend, we still need to do much more there, Chairperson. Similarly, the valid foster care were affected by the fact that at the Department of Justice, there will be many complexities, in some instances, children turning 18. Besen kulumile ke with the halfway houses, we could not reach the target. Ngoba ama halfway houses are khona mancane. Go capacity building, we managed to at least capacitate 302 of the 400. Under HIV and AIDS, 1,038 candidates were also capacitated. Chairperson, I will now pause and allow the acting CFO to take us through regarding the financial report for the end of the quarter. Thank you.
afternoon once more. I'm going to take you through the financial performance as at the 31st of March for the department. For the 25-26 financial year, the department managed to spend 99.3% of the allocated budget, resulting in an underspending of 36.7 million by the end of the financial year. This underspending was contributed by mainly from NPO as well as compensation of employee. The reason for underspending, under compensation, as you can see in the next slide, we underspent by 4.3 million of the allocated 2.365 billion on compensation. So the department in the fourth quarter, we received an allocation for early retirement program as well as voluntary exit program for officials who wanted to retire from government early. So out of those officials, not all of them, they were managed to be paid by end of the financial year as anticipated, resulting in that underspending of 4.3 million. Then under non-profit institutions, the department could not spend the 32.3 million, and the reason for that, it was mainly due to non-compliance of some of the organization, whereby the department could not fund them if they were non-compliant. So this has affected us, resulting in the underspending in that category. And then in terms of the conditional grant for EPWP, the department has spent 99.9%. The only underspending that was reported by end of the financial year was 5,000, and we have managed to also meet the targets in terms of the EPWP grant. Then in terms of the allocation for conditional grant, the department received additional allocation for conditional for infrastructure in the adjustment budget, and we were able to spend all the funds that were allocated in the department for infrastructure project through refurbishment of our institution, repurposing of some of the facilities like Dr Tlou Chokoe. The department has repurposed it from CYCC to a treatment center in order to increase capacity in terms of access to treatment center for the citizens. So on that one, the full budget has been spent. Then the next slide is just to show that in terms how did we perform in terms of payments of invoices within 15 and 30 days. Overall, when it comes to 15 days target, the department has managed to pay 93.13% of invoices that we receive within 15 days. And then for invoices 30 days target, the department has managed to spend 99.64% of our invoices, meaning that as soon as we receive invoices from supplier, we ensure that we process and then we pay them on time. Those that have not been paid on time, I think in the previous financial year, there were some challenges with the system, especially at the beginning of the financial year, whereby the new system has been introduced in the province, so it has affected our target in achieving 100% in those periods. However, the department is striving to ensure that all suppliers that are rendering services in the department, we pay within the 30 days period. Then when it comes to preferential procurement spend for the fourth quarter, we have targets that we have set for HDIs. The target was 80%. The department has achieved 89%. And in that category, we have managed to spend 263.7 million. And then in terms of the target of women-owned companies, the target was 40%, and the department managed to get services from a women-owned company, achieving 57.9%. So in that, for women-owned companies, the department spent 169 million. Then when it comes to youth, the target was 30%. The department managed to achieve 38.88%, spending 113 million by the end of the fourth quarter. Then for persons with disabilities, the target is 7%. That's where the department could not manage to achieve the target. We only managed to achieve 1.2% of the set target, and then we spent 3.5 million in the fourth quarter. And then on this one, the department is going to try to improve the spending this year by implementing workshops to make sure that we empower this category so that spending can improve and we manage to achieve the targets. Then on this slide, we are indicating township economy revitalization, whereby we are measuring the spending in terms of township-owned companies. The department, the target was 40%. However, the department only managed to achieve 28%, and then the total spend in the third quarter was 288 million for the companies that are owned by companies in the township. So also on this one, this year we are putting a concerted effort to ensure that we achieve the target by supporting locally owned companies. That will be the end of our presentation. It is recommended that the portfolio committee note the fourth quarter report as presented. Thank you.
Thank you very much, MEC. I think we can move straight to the questions.
Thank you, Chairperson. I will be taking the committee and members of the community through the questions emanating from the fourth quarter report and the preferences that they are flighted as I go through them. Thank you. That's the wrong one. Thank you, Chairperson, for the opportunity. The questions that emanate from the fourth quarter report are as follows. The committee asks us a question about the sustainability of our performance for the fourth quarter. They're saying beyond achieving expenditure targets and annual input, what evidence does the department have that accelerated quarter four implementation translated into measurable improvements in beneficiary outcomes, accessibility of services, and sustainability of interventions? Our responses are as follows. How improved expenditure performance translated into improved service delivery outcomes? The department expanded the capacity for inpatient treatment in halfway houses. Furthermore, the department strengthened aftercare services by implementing aftercare bootcamp for users who completed treatment for substance abuse. An additional 195 beds were funded in quarter 3 and 4 financial year. 3 new halfway houses were registered and funded with bed capacity of 228 beds. The department implemented an aftercare bootcamp to strengthen the aftercare program. The department also established a drug clinic in Tladi for the provision of outpatient treatment, aftercare and skills development. Whether beneficiaries experienced improved access to services and our responses as followed. The department performance showed a significant increase of 6% in Q4, 25-26 financial year, as compared to Q3. The table attached Annexure A outlines access of services beneficiary, outcomes and sustainability interventions, not exhaustive as it is limited to programs targets that were exceeded. Chairperson, we will just ask that the table be flighted. I'm going to have to rely on you now. Chairperson, in terms of accessibility, we are saying we expanded, in terms of the expanded public works program, 1,737 more beneficiaries were reached from the 8,188 planned annual target, with the overall achievement of 9,925 EPWP work opportunities realized. And I must say, Chairperson, because of the good performance in this area, we were even given additional allocation by Public Works. In terms of beneficiary immediate outcomes, the increased access to work integrated learning, which provides work experience, increased the employability, employment opportunities to 9,925 work, just scrolling, opportunities and improved organizational capacity to deliver services. 316 more contracts were awarded to HDI SMME companies from 1,300 planned annual target, enhanced increased market access to procurement spend, thus enhancing economic participation to HDI SMME redress, job creation, SMME development, track record enhancement to transition to bigger contracts, tender, black industrialists. Just go down a bit. In terms of the older persons outcomes, Chairperson, we are saying that the 6,311 older persons who access residential facilities accounts for an increase to access of about 165 more older persons who accessed our facilities. Similarly, 697 more older persons access community-based care services. That is 16,858 were reached from 16,161 target. Increased access to residential and community-based care services for older persons, improved care and protection for older persons. 21,561 more beneficiaries received psychosocial support services from 123,943 target. The increased access to psychosocial support enhance social functioning, improve mental health, improve education outcomes, orphans, vulnerable children and families affected by HIV and AIDS. In terms of program 3, we had increased access on the following programs: family preservation, 36,459 more beneficiaries reached from 212, 322 actual performance reach. And the outcome of this is strengthened families, capacitated families, family cohesion and family stability. Parenting program participation of over 1 million more beneficiaries reached from 1.125 actual performance reached. We had an increase of 93,679. Access to homeless drop-in centers, 16,530 more beneficiaries reached from 34,530. We had an actual increase of 18,000. Access to partial care, 83 more children were reached from 529 actual performance reach, with an increase of 429. Reported cases of child abuse, 855 more beneficiaries were reached from 5,093 actual performance reach, 4,238. Access to community-based prevention and early intervention programs, 16,037 more beneficiaries were reached from 47,527 performance reach. Go down. On program 4, Access to social crime prevention programs. Over 1.2 million more beneficiaries were reached. From 3.7 million is the actual performance that we reached, and our target was 2.5 million. Persons in conflict with the law who completed diversion programs, 744 more beneficiaries completed diversion. Accessibility of service reached access to improvement. So in terms of programs for the 2.5 actual performance, our target against the target of 1821, children in conflict with the law who access secure care centers, with a target of 730, we had an increase of about 118, reaching performance of 848 in terms of our actual performance. Funded VEP service centers, 7 more service centers were funded from an actual, from a target of 108. Our actual performance was 115. Victims of violence who access psychosocial support services, our target was 2.5 million, just over that. Wait. We reached 9,000 more beneficiaries with psychosocial support services. In terms of victims of violence who access psychosocial support services, over 4.4 million more beneficiaries were reached through programs of no violence against women and children, including 365 days of activism on no violence against women and children. Beneficiaries reached through empowerment programs, 363,593 more beneficiaries were reached from 521 actual performance. People reached through substance abuse prevention programs, 3.149 in terms of our awareness programs were reached. Beneficiaries reached through substance abuse call and walk-in centers. Our target was 17,220. We reached 15,222 more, equaling 32,000 reached for the year. In terms of NPOs capacitated, we had a target of 1,600 and we reached 1,711. Poverty reduction initiatives, we had a target of 393. We had an additional 133 reached. Food relief program, 102 more
HOD,
beneficiaries.
on
Yes.
that one, I want that list.
The list of
those capacitated. I want to
capacitated
see them.
NPOs.
Yeah.
Okay.
But not now, but I want them.
We're taking note, Chairperson. I hope my acting director on NPO partnerships is taking note of that. We will submit to the Chairperson. Chairperson, in terms of food relief program, 102,000 more beneficiaries were accessed through the food relief program. We had an acceleration program for food relief programs in the third and the fourth quarter, which enabled us to exceed our targets by 102,000. An additional measure was the rollover that we had received from the previous year. 50,000 more food parcels were also distributed against a target of 63,908. We actually distributed 113 food parcels. Go down. Income generating programs and economic opportunities, 28,565 more beneficiaries were reached. Income generating programs and economic opportunities, we had a target of 42,000, we reached 71,000. Skills development programs, 24,406 more beneficiaries participated in skills development. And I think this was as a result of our skills analysis gap and the implementation of Section 5F. School uniform packs distributed, Chairperson. We had an additional 24,200 beneficiaries that received a school uniform. We had a target of 104, we reached 128,000. In terms of dignity packs, Chairperson, We had a target of 1.590. Our actual performance reach is 1.59679, which was 499 more dignity packs distributed. In terms of cooperatives linked to economic opportunities, 41 more were linked from 526 actual performance. Our target was 425. Youth participating in youth mobilization programs, we had a target of 48,084. Our actual performance chairperson was 166,751, which is an additional 18,667 youth participating. Youth development structures, 51 more structures were supported from 154 actual performance. The target was 103. Women participating in empowerment programs, 7,027 more women participated in empowerment programs. The target was 25,820. We reached 32,847. Women on child support grant linked to economic opportunities were a target of 5,591. Our actual performance was 6,535, with an additional 944 women participating. In terms of sustainability of interventions, Chairperson, we're saying the allocated budget for compensation of employees, goods and services and NPI budget will ensure that we sustain our interventions. Furthermore, plans are afoot to solicit multi-sectoral partnerships which are envisioned to augment and sustain our intervention. We also, Chairperson, aim to institutionalize the accountability sessions that the accounting officer holds with the senior managers, which are weekly, held weekly. We call them the EXCO meetings. We also have similar meetings with the MEC on Tuesdays. So we do monitor performance quite closely, and we are confident that we will be able to sustain our performance, Chairperson. If we go back to sustainability of the NPO funding and service delivery, the question, Chairperson, is what measures has the department implemented to strengthen financially distressed but compliant NPOs? And how does the department assure itself that funding transfers translate into stable, accessible, and sustainable frontline services? And the department should demonstrate measures implemented to support financially distressed but compliant NPOs. The department has implemented a package of support measures for compliant organization experiencing financial distress in order to stabilize service delivery and avoid disruption to beneficiaries. These include prioritizing the processing of transfer payments once the compliance requirements are confirmed, ongoing engagement with affected organizations to assess the nature and extent of financial pressures, targeted program support to address operational risk threatening continuity of care. Where risks are identified, the department will also provide capacity building and compliance support to strengthen governance, financial administration, and reporting so that organizations can remain eligible for funding and sustain service provision. In addition, the department used monitoring information and oversight to identify vulnerable organizations early and facilitate corrective action before service interruptions have occurred. How funding decisions consider service delivery continuity and beneficiary access? Funding decisions consider the need to protect service continuity, maintain access beneficiary, and minimize risk disruption to essential social welfare services. In considering allocations, the department assesses the following: the nature of services that are rendered by the NPO, the vulnerability of beneficiaries, the organization's compliance status, the organization's past performance, and the extent to which the service required to meet statutory and program obligations. Priority is therefore given to services where interruption would have direct adverse effect on children, older persons, persons with disabilities, victims of violence, and other vulnerable groups. This approach assists the department in ensuring that available funding is directed to organizations that are able to continue delivering these services while maintaining accountability for the use of public funds. How does the department monitor whether funded organizations remain operational and capable of delivering services? We do the following. We monitor and review the regular submission of financial and non-financial reports by NPOs. Verification, we've now established a verification team over and above the monitoring and evaluation program that we have. So our verification teams then verify service delivery performance against agreed targets. Program monitoring by departmental officials through site visits, case audits, and developmental quality assurance. Where risks to operational sustainability are identified, engagement with the organization on remedial measures and monitoring of the implementation of corrective actions. This monitoring approach enables the department to identify emerging challenges, early support compliance, and provide reasonable assurance that funded organizations continue to deliver service to beneficiaries. The impact of NPO capacity building interventions. And the question here is whether our capacity building initiatives have led to reduction in governance and compliance findings. And this is our response. The department's capacity building and compliance support interventions contributed to improve governance and administrative discipline among funded organizations. The National DSD has decentralized some of these the functions previously performed by National DSD to provinces. This has assisted in fast-tracking the governance compliance of NPOs, leading to improved overall governance compliance across Gauteng NPOs. Through an ongoing monitoring compliance support, guidance on reporting requirements, and follow-up on identified weaknesses. Organizations were assisted to address governance gaps, strengthen internal controls, and improve adherence to funding conditions. The department will consider conducting an audit of the extent of governance conformance amongst trained NPOs. So we haven't done that exercise yet. Improvement in financial management and reporting, capacity building interventions have contributed to improved reporting among funded NPOs. The revised capacity building intervention plan for NPOs for 26-27 will include financial management. The improvement of sustainability and funding readiness of organizations through assistance with governance, compliance, reporting, financial administration, and program management. The majority of NPOs were better positioned to meet funding conditions, submit required documentation on time, and demonstrate their ability to implement funded services responsibly. Capacity building interventions are continuing to improve the sustainability of NPOs. The question here about reduction in repeat compliance failures. There have been a notable improvement in NPO compliance with provisions of the service level agreement, program requirements, and municipal bylaws. For example, a number of CYCCs were non-compliant during quarters 2 and 3, but this improved in quarter 4 due to implementation of various compliance interventions. Measurable improvements in service delivery outcomes following interventions. There was improved program performance during the quarter under review. In addition, there was a significant improvement in the audit of predetermined objective compared to the previous financial year. Performance and sustainability of supported cooperatives. The department must provide the status and performance of cooperatives that it supported during the financial year and demonstrate the number of cooperatives that are supported. Chairperson, we are saying we have supported about 526 cooperatives and linked them to economic opportunities. And the types of cooperatives that we supported include those who provided the following services to the department: garden services, laundry services, cleaning services, school uniforms, dignity packs, catering, rental of mobile toilets, and the rental of and hiring of chairs. So in most of these services, we've used cooperatives. The projects, goods or services delivered through cooperatives support the total budget allocated and spent. We are saying the department has issued 411 contracts to cooperatives for services such as garden services, laundry services, cleaning services, school uniforms, dignity packs, catering, the rental of mobile toilets and rental of hiring of chairs. The total value of the various contracts for the financial year amounts to 151,899,374.38 rands. Whether cooperatives remain operational and financially viable, the number of beneficiaries supported or jobs created, we are saying these cooperatives remain operational. However, financial viability remains a work in progress, and there are several interventions the department has put in place to support cooperatives in agriculture. Number of jobs created is 846 and 687 people in income generating programs. Whether these interventions resulted in sustainable income generation and reduced dependency on social assistance, there are cooperatives supported through the school uniform project and agriculture that are still in existence. People employed in these cooperatives are able to support themselves and their families. The fact that 846 people were empowered through cooperatives and 687 people participated in income generating programs can be used as an indicator that the interventions implemented by the department have indeed contributed to income generating and reduced dependency. End-to-end outcomes of the substance abuse intervention program. Following the substance abuse intensified campaign and treatment intervention during the financial year, the department must demonstrate the end-to-end outcomes of campaign-based substance abuse interventions, including what proportion of individuals identified through the campaign activities entered formal treatment. We are saying the Tswada campaign implemented on 27 October 2025 and 16 March 2026 reached a total of 19,516 people. 28% of the people were registered into formal treatment, and that translates into 5,548 outpatient treatment and inpatient treatment. How many successfully completed the treatment program? We are saying in total 3,612 service users completed inpatient treatment service at funded centers. How many transitioned into halfway houses and aftercare support? This remains an area that we need to strengthen, Chairperson. So a total of 33 service users were admitted to registered and funded halfway houses. Additionally, 23,152 recovering service users are participating in aftercare programs. Out of the 23,152, 991 were from Tswada campaign. What proportion receive skills development, employment support, or reintegration services? A total of 2,466 recovering service users participated in skills development programs in 2025-26. Whether beneficiary outcomes are tracked after exit from treatment, and our response is yes. The department has a tracking system for all service users. We have a problem called Bagai, and we track through this program those who attended treatment for substance abuse. Furthermore, aftercare is compulsory for service users who complete treatment for substance abuse, and the program is rendered for a period of 8 to 12 months after completion of treatment. All funded treatment facilities submit monthly aftercare tracking report that reflects all service users. What percentage remain in rehabilitated or avoided relapse? Of the 3,612 service users who completed treatment, 3,600 remained rehabilitated or avoided relapse, which translates into 99.6%. Program and sub-program allocation shifts. The department implemented significant allocation shifts during the latter period of the financial year, affecting sub-programs serving some of the provinces most vulnerable. Notable reductions included community-based care services for children with a minus 160 million, care services to older person with a minus 18 million, services to persons with disabilities with a minus 3.2 million, victim empowerment with a minus 1.9 million. At the same time, material increases were directed towards alleviation, poverty alleviation and sustainable livelihood, plus 157 million, women development plus 16 million, child and youth care centers plus 11 million, child care and protection 5.3 million, substance abuse prevention and rehabilitation 2 million. The department is therefore requested to demonstrate what informed these allocation decisions and whether they reflected changes in beneficiary demand, implementation, delays, inability to absorb, approve projects, approve budgets, deliberate policy reprioritization, or evidence that additional resources would achieve greater impact elsewhere. This is our response. Funds were reprioritized between sub-programs to alleviate spending pressures on goods and services, including G-Fleet, office building leases, building maintenance and refurbishment, food parcels, and dignity packs. Furthermore, the budget for school uniforms was reclassified from community-based services to sub-program for children to poverty alleviation sub-program in order to align the budget with performance information. The department should further demonstrate whether reductions affected beneficiary access, waiting lists, or service continuity. Services were not affected as NPOs were already funded from Q1 of the 2025 to 2026 financial year. Whether prevention and early intervention capacity was weakened, our response is no. No prevention and early intervention capacity was weakened. Whether compliant but financially distressed NPO were considered for support, all funded NPOs are compliant and require departmental funding in order to implement programs in accordance with prescribed norms and standards. How additional allocations translated into measurable improvements in the outcomes rather than expenditure recovery alone. We have an annexure for that, Chairperson. It's the same annexure that I have spoken to. Particular attention should be given to implications for vulnerable children, older persons, persons with disabilities, victims requiring shelter services, youth, poor household dependent on social support. Again, the annexure A that I read through also covers this. Q4 expenditure recovery and potential accrual risk. The department repeatedly attributed underperformance during the year to delayed procurement, delayed commitment of budget, delayed NPO payments, and implementation delays followed by significant expenditure recovery in Q4. The department is therefore requested to demonstrate whether accelerated Q4 expenditure created accruals, unpaid commitments, rollover requests, or future financial obligations that may place pressure on 26-27 financial year budget. The department's accelerated expenditure in Q4 did not create accruals, unpaid commitments, rollover requests. We did not ask for any rollovers or future obligations that may place pressure on the 26-27 financial year. The department should further clarify the value of unpaid invoices at the year end, whether any services or goods were delivered but not paid within the financial year, what measures were being implemented to avoid backloading expenditure and implementation during the final quarter. The value of unpaid invoices and accruals as at 31 March 2026 amounted to 81,523,000, and breakdown is as follows. 31 million was for Microsoft licenses, 24 million was for G-Fleet, 26 million invoices were also received and were paid within the payment period of 30 days.
Just go and do your own investigation on that Microsoft licensing. You see, MEC, for a very long time we've been seeing lots of millions go into this Microsoft licensing. Just do your investigations, Chair. Zoom there, MEC.
I will check but we pay through eGov. They are the ones that are responsible for this. We raise our concern too, because some of the licenses that we are paying all of us as Gauteng provincial government were not using some of the apps. So that's why I agree with you. And then we had to raise it with the ICAF. But because it's in the Premier's office now, the issue of payment, because Microsoft complained and then we were called, all MECs, that we must make sure that we pay what belongs to Microsoft. Because in fact, I think we're number last to pay because of the issue that you are raising. But I raised my concerns and the team raised them in the ICAV team. But it's something that we must pursue, Chair. Yeah.
Just like we fought DID, I think we can fight this. So you can be in charge of that money. Okay.
That's fine.
Thank you, MEC. All departmental accruals at year end were paid within the first quarter of 26-27 financial year. All the accruals were due to budgetary constraints in 25-26. In terms of compensation of employees and internal budget reprioritization, the analysis noted that compensation of employees reduced from approximately 2.412 billion in quarter 3 to 2.365 billion in quarter 4, representing a reduction of approximately 46.8 million, despite the department repeatedly citing staff pressures, vacancies, and implementation constraints as factors affecting performance during the year. At the same time, approved posts increased from 5,060 to 5,298. Vacancies remained high at 648 by the year end. Acting positions increased from 17 to 31. Only 5 permanent appointments were reported during quarter 4, and the department continued to report staffing-related implementation pressures across programs. The department is therefore requested to demonstrate which programs and sub-programs experience reduction in terms of compensation of employees. And the table below reflects the reductions that were experienced. Administration, there were reductions in Office of the MEC, corporate management and district management was affected. Social work services, management, support care and services to older persons, services to persons with disabilities, HIV and AIDS. Children and families, management and support, care and services to families, child and youth care centers, sub-programs. In terms of restorative services, management and support, crime prevention and support, victim empowerment, substance abuse prevention, rehabilitation, management and support in terms of development and research, management and support, community mobilization, poverty alleviation and sustainable livelihoods, community-based research and planning sub-programs. So, Chairperson, we were actually affected across programs. The value of funds shifted from compensation of employees and where those funds were ultimately allocated. The total value of 64,461,000 was shifted from COE, and funds were allocated as follows. Administration programs, 32,529,000. The amount of 32.5 million was reprioritized to goods and services to alleviate spending pressures on office building leases and contract workers. In terms of children and families, 221 million was reprioritized from compensation of employees to G-Fleet. Expenditure to alleviate spending pressures and to offset expenditure incurred on households for leave gratuities for officials who exited the public sector, and payment for early retirement program and voluntary exit program. In terms of restorative services, an amount of 1 million was reprioritized to goods and services to alleviate spending pressures related to contract workers. In terms of development research, funds were allocated within this program to alleviate spending pressures on dignity packs and food parcels.
HOD, is it allowed? What the department has done there?
Yes, Chairperson, we actually sought advice from Treasury, and we were allowed to reprioritize from COE to goods and services, but we can't take goods and services to COE. We can't do it the opposite way.
Isn't it the money that you were supposed to have created employment? that you have just reprioritized and saying that?
Chairperson, the challenge that we had was that the provincial government was trying to manage the ratio between the head count as well as service delivery. We were all given a ratio of 60-40. We were not to exceed that 60-40. So even if you have funded posts, you can't advertise and fill those posts to ensure that you manage the 60-40. In fact, it started with national managing this problem. I think the province that was hugely affected by this was KZN. Gauteng was keeping a close watch on how we are spending on COE. Okay. And hence we couldn't, even though we had pressures, we had the budget, we still couldn't spend.
Yeah, you see, the problem of unemployment in our country and in our province is serious. Now, to get an answer like this is really assisting us. We will take it up with the other committees. MEC, this is scary. We are having the youth that are unemployed. We are having positions that are vacant. The department doesn't hire. Instead, they prioritize, and we can see it's not your problem. It is a system that is up. We will look at it. No, wait, you guys. Okay. All right, thanks. You can continue, Judy.
Thank you, Chairperson. That would assist greatly, as I have been told by Treasury that with the recent post that they've given me, they are not going to be giving me posts in the foreseeable future until we've resolved the issues of budget constraints. So it would help if we take it up at that level. Chairperson, where was I? Remind me now. I've lost my track.
I can go because he's already asked. So you're here.
Yeah, I was here. Okay, so if we go further, whether funded vacant posts were redirected to other expenditure categories, and our response is that posts were not redirected, that the department could only fill posts in line with the approved post-filling plan and within the cost implications over MTEF. The surplus funds were mainly attributed to posts that became vacant over the financial year. In terms of whether service delivery posts were affected by these decisions, service delivery posts were not affected by these decisions as alternative arrangements were implemented through acting appointments, internal reassignments, and other operational measures to sustain program implementation. In addition, 159 social work interns and 43 social auxiliary work interns were appointed to provide support and alleviate service delivery pressures. These interim measures enabled the department to maintain continuity of services while addressing staffing constraints within the limits of the approved post-filling plan and available MTEF funding. The extent to which vacancies affected program implementation and service delivery, our response is as follows. Vacancies did place pressure on program implementation and service delivery in some areas, particularly given the high vacancy rate and the limited number of permanent appointments during Q4. However, the department mitigated these pressures through acting appointments, internal reassignments, and other operational measures, while also appointing 159 social work interns and 43 social auxiliary work interns to provide additional frontline support. These interventions enabled the department to sustain program implementation and maintain continuity of services within the constraints of the approved post-filling plan and available MTF funding. Whether critical posts were deliberately left unfilled while personnel budgets were reprioritized elsewhere, critical posts were not deliberately left unfilled in order to reprioritize personnel budgets elsewhere. The department could only fill posts in accordance with the approved post-filling plan and within the available MTEF funding. The high level of vacancies was mainly attributable to carry-through effect of the COE budget over the MTEF and unavailability of funds in the outer years. To mitigate this impact on service delivery, the department utilized acting appointments, internal reassignments, and other operational measures, supported by the appointment of the 159 social workers and 43 social auxiliary workers. How the department balances temporary employment interventions such as internships, EPWP opportunities with the need to strengthen permanent institutional frontline services. The department continues to balance temporary employment interventions with the need to strengthen permanent service delivery capacity by utilizing internships and EPWP opportunities to support work exposure, skills development, and immediate service delivery needs, while also prioritizing the filling of critical permanent posts as funding becomes available. Although the filling of permanent posts requires MTF funding, which is currently constrained, the department is undertaking the process of identifying critical posts across institutions and corridors. I've already spoken to the impact of EPWP in the previous paragraph, Chairperson. If we could move to the next one. The department should further explain whether recurring movements from the COE indicate structural challenges in the workforce planning, recruitment or budget management, and demonstrate whether the movement of personnel funds improves service delivery outcomes or primarily supported expenditure recovery elsewhere in the budget. Our response is the recurring movement of funds from COE does not indicate structural challenges in the workforce planning. These movements are driven by the need to realign spending to address immediate service delivery and operational pressures within the financial year. The reprioritized compensation of employees' funds were applied to critical areas of need within the budget to sustain service delivery and address spending pressures. On poverty alleviation, funding increases and planning assumptions, Chairperson, the question is, poverty alleviation and sustainable livelihoods received an additional 157 million during the latter part of the financial year, despite having an approved annual allocation at the beginning of the year and receiving support through the adjustment budget process, including additional funding provided to address prior year commitments relating to food security intervention. The department is therefore requested to demonstrate what factors necessitated the 157 allocation. We are saying the increase in allocation was mainly due to reclassification of school uniform budget from sub-program community-based services to children to sub-program poverty alleviation and sustainable livelihood to align the budget with performance reporting. Whether original budget allocation was insufficient, if so, why was this not adequately anticipated during the planning and budgeting process? And our response is, the original budget for school uniforms was allocated to sub-program community-based services to children during the year, and the budget was reclassified to align with performance information. Whether the funds initially allocated to poverty alleviation were redirected elsewhere during the year and subsequently returned to the program, we are saying the funds for poverty alleviation sub-programs were not redirected elsewhere during the financial year. Whether the increase was driven by increased beneficiary demand, implementation pressures, or reprioritization decisions, the increase is due to reclassification of the school uniform budget of the 157 million. What additional activities, interventions, or outputs were funded through the increase that were not already provided for original? You will see, Chairperson, that most of these are similar in terms of how we are responding, because that increase was not as a result of funds being redirected, but the reclassification of the school uniform budget. Whether the additional allocation resulted in expanded beneficiary reach or improved outcome beyond those originally targeted. And again, we are saying this was just a reclassification of the school uniform, not an increase on budget. How the department distinguishes between expenditure recovery and genuine improvement in household well-being and food security outcomes. And our response is that the department distinguishes between expenditure recovery and genuine improvement in household well-being and food security by assessing both financial performance and non-financial service delivery outcomes to determine whether spending has translated into meaningful impact. The department also considers program performance information, including the number of households reached, the number and consistency of the food support program, and observe improvements in beneficiaries' access to food. Genuine improvements in household well-being and food security are measured through reported service delivery outputs and outcomes rather than expenditure alone. What measures are being implemented to improve planning, forecasting, and budget for poverty alleviation interventions in the future? And our response is that measures are being implemented to improve these through improved needs analysis, better alignment of budget with program priorities and enhanced monitoring of expenditure trends. The department will also strengthen coordination between planning and finance units, including program units, to ensure that targets are informed by available budget and implementation capacity. The last question, Chairperson, on Q4, the department should further demonstrate the direct impact of the additional allocation on vulnerable households and explain why substantial additional resources were required despite the program already receiving both original allocation and adjustment budget support during the financial year. And we are saying the school uniform budget was reclassified from community-based services to children to poverty alleviation program to align the budget with performance information, and the department distributed 128,700 packs of uniforms in 2025-26 financial year through this allocation. Thank you, Chairperson. Those are our responses.
Thank you very much, HOD. The following car is a Haval, registration number LH36SFGP. May you please move it, as there are other people who want to go out. Haval LH36SFGP. Thank you, HOD. Thank you, MEC. Those were the questions that the committee have sent to the department following the fourth quarterly report that has been sent to the committee. So we decided that let us send these questions. Now, this is the work that the department has already done. This is what they are telling us, what they have done from January 2026 to March 2026. And then we have asked those questions and they've answered us. We're now taking it to you as the public. From the presentation that you saw, that has been presented here, do we have people who want to ask questions? Even if you have asked the questions during the previous 2 items, you are allowed to ask questions again. So you can ask the department this question, because as the committee, we might have asked questions which we have missed others. So I'm going to look at this side first. This time, last time I started that side. So this time, I'm checking this side. Do we have any hand? Okay. Going once, going twice. There is one hand. All right. Atlanta Tokomrao, number 2. Finished. All right. And then you must raise your hand. Then you will be number 3. Okay, you can come this side. And then can I take hands this side? Okay. Don't ask questions. Okay. Okay, you are number 1 in that. You are number 2. By 2, I get 1, 2. And then 3. Mekomrao, you are number 4. And then number 5. Kone. Lena emang ka maoto until ba lefa dijo ke tla qala ka ba. Otherwise le tlo mesa dijo le sa botsa dipotso. Okay. Okay, that number, last one. Normally what I want is that those people that I've counted, Batla Mopil, so I've got 5 hands, ne? Yeah. 7, yeah. Etlang ba ka mo sighting, my worry is that kinkile matsogo kam. Ke qetile kam. So, but because re sa batla ba le bathole dijo, tla ke oketse. Phamisa ngapi? Etlantate, o tlentate ko morao. Etlong le joine. All right. Now we all have our people, ne? So number 1, TV, you can adjust your things. Let's wait for the TV to adjust the camera. right? Don't forget the 3 minutes rule so that we can share with others and be considerate for the time. Who starta memo ki number 1, not when. Yeah. Kwena mme. Kwena. Yeah. Qala. Okay.
Dumelang ba botle. Leina la ka ke Priscilla Marema hae Gwebu. Ke tswa ke le Mabopane. Na complain ya ka ke hore Mabopane e ditshila. Mabopane e ditshila. Di dumping tse di leng ko Mabopane di lwatsa bana ba rona. And then ha go motho wa itshwenyang a gona le batho ba ba berekang mo motseng ga bayo. Ene ya bobedi ke hore ke na le 53 years ke nna ko Mabopane mara di strata tse 7 ko Mabopane ko di ko Mabopane a dina tar road. And then the strata tse tsotlhe di na le tar road tse ba ipetse di pipe ba se tlohetse fela diana. Instead hore ba re tshelle skontiri ba khogola di kontiri tsa ko bo social nguve tsa ko kae ba tlo re tshella tsona ba bipa ka tsona. Dianong so nna re na le complain ko Mabopane.
Thank you, ma'am. Now you will understand MEC and HOD why I said answer our questions first.
No, thank you, Chair, and CBOs and colleagues and departmental heads. Mine is 3 submissions. The first one is on the green door policy, though it has been answered that it should be considered as funding allocation, as much as we have identified such under that. But my main submission, HOD, is reprioritizing and including the issue of hiring professionals in terms of the departmental work, where you are saying the departmental is planning to focus in delivering the service itself, but also cutting professional employment that also speaks to delivery. And the last one speaks to the school uniform numbers. And I can tell you, it goes back to my submission. Tendering system in a social space, we were supposed to deliver a huge number of supply based not on market related, but based on skills development. Go back, I've got a manufacturing factory.
Sanibonani mphakathi. Greetings to the honorable members. I go by the name of Unaledi Tsiane. I stay in this ward, La Khona, Whiteville, and my organization is Whiteville Youth Hub. So I don't know if I can call it a clarity-seeking question regarding unemployment, because basically our organization, as I'm looking around, there are less young youth-owned organizations who are owning NPOs, and basically our NPO is also dealing with youth unemployment. So I think I'll just go to that unemployment. And I just want to find out if the department is saying to us that from January to March, this is how, or this is the budget, or this is how we have employed in Tesnaganjal. I just want to find out how are the divisions being made regarding if we are in Gauteng, in Ekurhuleni, the submissions, how many did you, or I don't know how can I say it, because I don't know if we do not reach such opportunities. So my question basically is about how is the department saying that they are accountable for organizations, ukuthi, okay, this is the school uniforms that we've brought here at Ekurhuleni, and basically which organizations maybe that were distributed to, because now we need also organizations to be accountable. It's not only ukuthi when the department comes in and then they submit to us and then we say like, we don't know of such. But then if the department can also be transparent with such information, I think nje it's only gonna be that. And then the last one, ukuthi, sometimes these programs, it's just an advice, ukuthi, these programs are very important. Can the department most of the time come to us? It must not just be when they're just coming to deliver. You guys, sorry for calling you guys honorable members, please normalize coming into our communities, because we need such programs. We need to be facilitated. We need to understand how to operate in our organizations. So for now, I think, thank you.
Molweni, bulisa abahlali ngaphambili, bulise wonke umuntu osendlini. I have just 3 submissions. Okokuqala, my worry is, now, Tina, for example, we were working abantwana. So we have been moved to program layer food parcels. Because of infrastructure and. So what happened is now, we got food parcels. We have 100 beneficiaries. No, about 100. So then now, but we got 29 food parcels and per quarter. So now, ababantu, they're going to eat ngekota. So that is what worries us. And then, okwesithu, sine problem yokuthi abantu, yeah man, that's what ndimphendula. So the other things, sine problem yoba, ama NGO, since 2022, abantu have been earning the same salary. But is it possible, for so many years, we are increasing everything, but we are staying? Oh, good child and Chokoe 45,000 how many years ago? Kusasenjalo nangoku. Can't these things be reviewed? Ama managers wethu, I mean, batung siyacela, social development mayisicabangele. Nathi sinama families, sinabantwana. And then the last part, the last part, my other worry was, it's fine, Dilibel.
Sanibonani mphakathi, sanibonani baphathi. Siyabonga kakhulu ukuba nani namhlanje, oswena namhlanje. Siyabonga, siyajabula futhi ukuthi siyaphendula kuko konke. Ngizocela nje ukubuza kancane kusisi laphana ukuthi si applyile kodwa asitholanga any letter, asitholanga next, si complyile, no SLA, no report, akuthulekile nje, and manje uJune asazi ukuthi kwenzakalani. Ngiyabonga.
The name of your organization?
Ngusinenhlanhla ngokamnyekezi, organization yami i-Felix Methodist Church for the Age. Amen.
Where is it?
It's in Pinoni, here in Pinoni.
Faith what?
Methodist Home for the Age.
You
Felix.
Okay. You didn't get any response?
Nothing, no response, nothing.
Okay.
Felix.
Which program did you apply for?
It's an outreach and luncheon club.
You sure you applied?
Yes, I did.
On a proof?
We've got a letter that we approved.
Mind you, your questions are.
We did receive a letter that we approved.
That you applied or you approved?
Yes.
That you applied?
I did apply. Yes, I've got the letter. And then I've got the letter that we approved.
Oh, yeah.
No, we didn't sign the SLA yet.
Okay. So you've got a letter that says you've been approved. Sharp. Let's give others a chance. Okay, another one.
Good afternoon. My name is Sianda Kuta. I'm from the Wattville Men's Forum. Wattville Men's Forum. I've got two things to talk about. The first one, we are a registered NPO, and we have submitted our documents to GST in Pretoria. But for the last 2 or 3 years, we've been waiting for them to bring them back to us with a stamp, with our constitution. We've been waiting for that document for the last 2 years. And we've been sending emails to no avail. No one has
What are you waiting for?
Waiting for our constitution and our registration basically to come back from DST.
From national, ne?
Yeah. And it's basically hampering us from going forward with applications and so forth.
Okay, you will give them your contact, they will assist you.
And also, just want to speak to the issue of the substance abuse programs that you have. I heard you say that your numbers from the guys from the campaigns that you had about 3,000 people that went into the inpatient program, and so far with your tracking, you've got like 3,000, or basically 100% people that have remained clean and sober. Now, I've also been in that space of the recovery space. Now, what I know, the stats there are about 8 out of 10 people relapse. So in order for you to have 100% of people basically remaining clean and sober, that's like a miracle of biblical proportions. So one which then speaks to the people that are tracking. Are they giving you the correct information? Are they giving you correct results? Because if they're saying that there's 100% people that are clean, then yeah, there's a problem there, because that is impossible. And also on that same subject, I haven't seen any programs coming through, be it from NPOs or from DST, basically that are speaking to or making awareness and speaking to the families specifically about the problem of substance abuse. So we have people talking to the actual addicts and the alcoholics, but no one is speaking to the families, the people that are supposed to be their support structure. Because at the end of the day, those people also don't understand what this thing is. So we need to have programs where people are actually speaking to the family members, speaking to the community at large, because that's how we have mob justice. That's how we have people that are being shunned. That's how we have people not being reintegrated into communities, because we don't have any programs that are speaking to them. So I think it would be an awesome thing if we could actually just deal with that as well. Thank you.
Sanbonani. Greetings, MEC. All protocol observed. My name is Monde, surname is Ndebe. I'm the founder of Recovery in Unity Network. When we conceptualized Recovery in Unity Network, it was precisely because of the point that the gentleman that just left made. Because what we're finding out is that sithatha abantwana sibayise kuma-rehab, but we're leaving parents behind who themselves also need some sort of like a reset, because they were used to, interacting with a person who's highly charged most of the time and so on. So recovery, we call it Rayun. So what it does, it provides support to recovering addicts, and it provides support to parents. And we also advocate for recovering addicts within the community, because ukurelapsa kwabantwana is also caused by the reception yomphakathi to abantwana. Now, our issue is that last year we had, from Wattville, we had 17 addicts that went through the system. But maybe let me premise my input. Qala ngokuthi HOD, I acknowledge what delivery model. Because basically what we do, we collect the information, we support, and we interact with social workers. We collect the information, we support, and we interact with social workers. We have 6 social workers at Depo. We want to know, was Dr. FNF paid? Were they paid? Because the stories that we're getting from abantwana was that akuna kudla, ukudla kufanele
Now what you are telling us, need John. Go to John, the MEC is here, the team is here. You can explain that. So we appreciate that, and you can even come to me. Let us give the other sessions now. So your point is very clear. FNF is a government institution, so it's got its own resources. But what you are telling us is an investigation that is needed. So I will say, you're gonna meet the MEC or somebody that will be allocated to you. From the committee, we'll send John to you, then you will narrate your story. Okay. Thank you very much.
The last one, I just wanted
But
to
you have
make the
taken
last-
more than 5 minutes.
Is it?
Yes.
My apologies.
Okay, state your point now, the last one, so
Yeah.
we can give that. Then those other ones can come up.
My last point is that this time around we had more than 80 addicts that were sent through. All of them had to turn back. And again, it was an issue for us to actually receive the answer. Can I make a suggestion as I sit down? As areas, we need to get a sense of status, say social welfare in our areas. And we don't have, such things. When you look around in communities, there's a serious problem about mental health and issues of addiction.
Thank you. Thank
Now,
you. You're
we-
going to
we
come
are
to me.
asking- we
When
are
now
asking-
over than
Ke tle ko wena.
Yeah. Give the other sections.
Sanibonani. Sanibonani. Igama lami nguMandla kwaMadondo. I'm from an organization called Tolimfundo. We are immediately
Maybe just before you start, MEC, the last two speakers are saying to us as the government, when NPOs apply, let us not just have this club thing of say, we fund this. Let us allow NPOs that are thinking out of the box. They are saying, you now fund NPOs that will go and assist us with a child. But here they come up with a proposal, say we want to deal with families and we want to deal with this problem here at us, and they don't get funded. So let the department look at it and fund new ideas. I think that's the message they are sending. Eh? All right, carry on.
No, siyabonga ithuba man ukuthi nize from kwa-DSD. But before maybe I say 2 points, ne? Ama-point wami awekho maningi mabili. I think we are privileged to have a leader, u-MEC Omam Nomantu ukuthi bamlethe la, because we have many problems. We know her from kwa-health ayitholi njani, wafika wayimisa ngezandla, wafika wayimisa ngeenyawo. Mam Nomantu can speak to the cleaner in that department. Let's hope Mom is going to do that kule dysfunctional DSTS now. Let's hope we're going to put that effort. Because it can't be that kule nkinga esinazo la kwa DSD in terms of lack of funding, but there'll be 110,000, 100 million that is going to go back to treasury. What about these people that must be supported here? So it can't be like that.
What did you get that figure?
No, it's an information that is there.
No. It's not
No,
from
it's
this.
an information you can do that.
My bro, we are discussing the presentation that was put here. There is not that money here. It means you were not listening.
No.
So please engage the proper presentation. This department didn't send 100 million back.
No, I'm saying in the last financial year.
This department didn't send 100 million. If you were listening in their presentation, you will see. So give the other one, these ones you were not listening. They didn't return any money.
No.
They
I'm
only
not
returned
saying-
36 million.
Ungzo, I'm not saying now.
Yeah, but don't accuse them.
No, I'm saying the report says.
In
Not
the
this
report, there is no report that says that. Make your point. I have to help you. Yeah, don't come with misinformation. This presentation was put here. All of us, we were watching. No 36 million, no 100 million, but 36 million. And they even explained how it went there.
Or
Up
maybe
to the last 10 rand.
We got the wrong information. But as the organization of youth and other people, let it not be that it will go ezinye izinto ziphume eceleni without being funded, because social development is a very important organization. It's a very department. Yabona? But in fact, I wanted to push that because you are saying I'm wrong with my own analysis. I'll just leave it there. Thank you.
Molweni, sanibonani, dumelani, absheni. Igama lami ndinguCynthia Mazaka from Exasalet. Exasalet. Freedom Park. Andizangikhuthiza into ininzi apha into ekhaya ndizele apha yeyokuba siyaniva sinivile zonke into nizithetha into isicelo sam siyi-one apha kuni khani khe nilandelele niye kukuthiwa umazaka aye phaa nawugqa nihlale ningamlandeleli umazaka athathe imali yenu okanye imali kagovernment ayoyisebenzisa kwakhe neetshomi zakhe nina nibe nihlele apha isicelo sam khake nilandelele xa nisithumele izinto pha siyaziva niyathumela niyathi iimali ezingake eziteni sizimamele kodwa aziyindawo ziphele kwalapha kuni isicelo sethu ke khange nithumele umntu nimlandelele nimthumele umntu phaa ekusasa lethu wafika wathi akukho bantu phaa kanti sikhona wathi akukho kwamntu phaya kanti sikhona abantwana bethu zii-caregivers door to door ubanda kutshisa kunjani abarholi banee-families kodwa imali nayikhupha anilandeleli cela nilandelele.
Thank you. Thank you, Gogo. You see the monitoring and evaluation team. You see now Gogo is crying. The monitoring and evaluation team. Thank you.
Dumelang. Lebitso la ka ke nna go itsimang ke tswa ko Harankua ko organization e ba bitsang Tshedimosetso Youth Network. Nna chairperson ke na le a ke tsore ke re ke complain or ke question. Ke kry-ile funding e ba reng it's a full funding ka last quarter, January, February, March this year, financial year. Ka kry-a tšhelete ba re ke full funding, mo full funding tšhelete we couldn't spend the whole amount of money because tšhelete re kry-ile ka last quarter. A ra spenda tšhelete we have to deviate. Ke deviate as organization up to now I cannot respond. Ke Tshedimosetso ko Harankua. Ke deviate up to now ra etsa di quotation ra etsang no respond to deviation e requesting to say ka one re kry-ile a full funding ka last quarter re kopa department ho na le dilo tse re di tlhokang SDIC program. Can we buy dilo tsa bana because we have never been funded and rapela bana ba tlhoka ditilo bana ba tlhoka equipment bana ba tlhoka tsele le tsele. Can we use that amount e re kry-ileng as a full funding mara ele late to buy those things so that bophelo ba program bo tswelle pele? Up to today nobody responded. My last question ke hore we took the buka ko auditory. Auditor asked me, ke nna manager, one question, why would you department to give you full funding ka last quarter? Because it really doesn't make sense. How report I really auditor re bona di buka tšhelete e tsene mo statementeng e le kana kana o sa e berekisa. Ko bofelelong department tlebe e re wena ha o qualify ho kry funding because ho na le tšhelete o e kry-ang o palla ko e fetse. Ke a leboha.
Okay, make sure that you come and see the HOD so you explain your story.
Sanibonani nonke. Mina ngizela ngaphambili I think ngiphethe I need clarity based on indaba ye performance. Ku social behavior change program I target yethu last year beyithi 150. Oh, funekani community project eSoshanguve. Funekani PFU. Funekani NEKANI eSoshanguve. Yes, I target yethu beyithi 150 last financial year. And then sathi nasiyo signa SLA basitshela ukuthi kule first quarter kumele si reach I-target iti 133. We understood that. Then kwathiwa second quarter, third quarter, ne fourth quarter, fanele imove from 133 to 1,730. And then sifuna i-clarity lapho ukuthi sisuka kanjani ku 150 ku last year, last financial year, then first quarter siku 133, then second quarter kuye ekugcineni siku 1,730. Nge-stationary se 200 rand. Amaphepha amaningi kangaka. So sidinga i-clarity lapho ukuthi simuve kanjani ku 133. Manje fanele so submita i-133 ku first quarter. But ku second aniyavala first quarter manje. Ku second quarter going forward we are expected to submit 1,730.
We heard you, ma'am.
Sifike
We heard you.
kanjani lapho.
Thank you.
I-program ye social behavior change. Ngiyabonga.
Dumelang. Thank you very much, Chair, MEC and HOD. My name is Dr Tlou. I'm from Soshanguve, from an organization called Bophelong. To add on what the speaker was saying right now, because it was one of the things that I really wanted to go to. I saw the presentation on HIV and AIDS and what was presenting the 100%. But somewhere, somehow, I think there is a missing column. The column that must speak to the extra work that organizations are putting. You're funded for 50, but you're able to give a report that says 350. Where is that figure done? Yes, it's HIV. Because of these figures, at the end of the day, they bring pressure to our people. They bring pressure to our caregivers. They bring pressure to our staff members. Because the report spoke to the money that was returned because of the non-compliance of the organization and so forth. But the department was able to reach target. How? Because of the pressure went straight to NPOs. What she was saying now, for the department to reach target, when they close 4 organizations, they will share the work of 4 organizations within the remaining organizations so that they can reach their targets. You see, it's no longer right for the psychosocial of the caregivers. It is pressure that is being brought to our staff because now they must close the gap of the organizations that were defunded. You see? So it's a problem. It's a problem that needs to be looked at.
1 minute left.
As much as you are reaching your target, but on the ground we are suffering, we are struggling, we are feeling pressure because we must close the gap of the people you are taking the money from. The other one is, it's a plea for the non-funded organizations that are servicing our people. Because some of these organizations, after you take that money, they come up with ways of continuing the services, as much as money is no longer there. But now, the problem comes when their staff members are left out of the skilled programs. Yes, you are not funding them because of the problems that were there within the organization and the department. But the staff is still servicing the community. Because of the story of saying the department will take these beneficiaries to that organization and take them, that is not happening. That is not happening. Those beneficiaries are left stranded. If the organization closes door, the beneficiaries are left stranded. they are not taken anywhere. Maybe your report says they were referred somewhere, but in actual fact, they are not.
Thank you. The rest you will bring it to me. No. You will bring it to you. You talk, you explain, you express too much. Go.
Afternoon, le Baitapel. Rakumong Chuksmuchuluhi from Community Regeneration and Development Center, Citibeng. I'm not going to talk on behalf of the organization. I think the recommendation that goes to issue the bylaws, please take it up seriously, because the bylaws have created a situation whereby 50 to 60% of our drop-in centers have been converted into HCBCs, which no longer do what the DICs were doing. Renali issue the capacity building. Yes, capacity buildings are happening at this particular stage, but there is no recognition thereof. People have been trained to be from through RPL, and this has no significance on people who have been trained. They are not absorbed anyway. Number two, the issue of food relief. I heard a report there, 53,000, from 53,000 to 103. Maybe it's through sustainable livelihood. But what I can recall is from our NPO side, we are now, from 100 food parcels, we have been asked from Citibeng to go to Centurion, Pretoria, collect 10 food parcels out of 100. So it's minus 90, but the department is saying they have distributed more than what they had planned for, maybe through sustainable livelihood, and it will be good for them to take the food parcels as their baby and continue bafeba to dijo. Then the other issue is on MNE. Can we have an MNE that is standardized? But warona ba MNE habatswa officing tsa bona batla di officing tsa rona. Haba ke batla ka style say one. Not different styles, because I want to penalize this one, I will do this. I want to save this one, I will do this. Let the standard be the same. And then the other one, in Citibeng, we still have organizations that have not received their funding, whereas they have received the letters of the letter hearing, we are going to fund you. Maybe after this, we'll give the names of the organizations that have not been funded to saying Mangolo Aring Ro Amuhetsi ka hae ka mona. Thank you.
Thank you very much. And again, monitoring and evaluation.
Thank you very much. Dumelang setjhaba sa Ntate Modimo. Ntho ke tlo e buang ntate o sa e buile. Ke ntho na le bonang ke dula fatshe. I'm the one ASAF signelang SLA. Ke kentse di business plan, ka thola di approval letter, everything. Ka ba ka thola le appointment letter, se ne re di fuwa ke MEC mo Joburg City Hall. Hore everything ya rona ke lo signela di SLA, but till now a so signele SLA. Problem.
Ya lena ke your organization.
My name is Alina Pete from Diranka Kagiso, Citibeng.
Thank you. Thank you, Batla. Take. Thank you very much, MEC and HOD. I think you can, most of the questions I see that were answered, I think we can close. You have seen the Batuba Gauteng. This table here haven't eaten. They've not even stood up for break, listening to you. It's just that Batswenya MEC Misa for briefing and she has to, but she has been here with us. Lerena, we've been here. So they are going to answer briefly, summarized, and then so that Lerena chaise handle roja, azanga raja. But we respect you, we make sure that the program run from start to finish. MEC, I'm handing over to you, and then I'm gonna cover the rest.
Chair, HOD and the team will answer some of the questions. But Chair, the issue of municipal bylaws, we note it, we take it, and the regional directors are going to work very closely with the municipalities. On my side, Chair, I have a meeting called IGR that brings in MMCs of social development. We will raise it even there, Chair, because even in our meetings, we raise the issue of municipal bylaws that we must attend to it as a Department of Social Development. So it's something that we agree with what it was raised in the meeting. Then, Chair, on the issue, we're going to have a meeting, I think HOD indicated that in one of the questions. We'll have a meeting with all the organizations that were funding, categorize them. For example, UCC was complaining about the targets. That meeting, Chair, I'm sure we'll even invite you. It's going to be a meeting, sort of a workshop. How many people do you are supposed to reach in a quarter that you must support that are HIV positive, if it's HIV positive that you are dealing with? So we need to standardize that, Chair, and the person must know that you can't reach only 100 people in a quarter. Unless bahlala kwakho and then you keep them in your place and then by 100. But if you are supposed to do door to door, go and check them when there are meetings like this one. That's why I was asking the team that we're going to communicate with you guys. When we go to areas like this, we're going to bring our service delivery teams so that when we are inside the room, all the other stakeholders esidila nazo NPOs ezinye ziyasebenza ngaphandle, so that we can even reach out to more targets than we are reaching now, because we need to reach more people. If it's sustainable livelihoods, we must have more. So where we are going to have the teams outside. So we're going to do the just 7 now, so that abantu bayibone meeting yakuthi indeed it's a practical meeting, that when a person says we don't have food, you are saying go and register outside. The truck is there that must help you. If the idea yiko uthi nangu Home Affairs ungaphandle pa nabo mabakuncedise so that you can do that. We work even with the banks, Chair. If bathi bafuna uvula account for the grant yakhe, apply the grant, but the banks are outside. SASSA will be outside. So what we do in your absence, we want to do it even when you are somewhere now in a community. So, but we'll communicate properly with your team so that we make your work more easier too. We have noted the issue of monitoring and evaluation. That's another area, Chair. After that meeting that we had with you, a food bank, I knew that from that day that there's something that we are not doing right in terms of M&E. Hence, we are going to have that team, but how do they work? So when the assessment, Chair, then we see how best can we service the citizens, Chair, because it's important. Then, Chair, on the issue of capacity building, I agree with you, Tata. That's what I raised to them when I arrived at Payana Kwam. We cannot train people for 3 months, then we throw them on the street. We must continue with that. They listened, Chair, because last week they had a meeting with the Department of Higher Education, so that we can have now NSFAS that will say these children, ufuna continue ngale crash course in Menzeleyo na ICT. He wants to go to the university, to TVET college, ayo continue ngayo. Lo mama lo ufuna ukwenza lonto leyo kanjalo kanjalo. We're going to do it, Chair. Already it's something that the department have listened. Will this capacity building and the training that we are doing in the centers, it's going to be much more better than it is now, so that they can be recognized, but certificates. That's why even when we train them in our institutions, NPOs that are doing the training, we're going to link them with these universities, with these TVET colleges, so that ufundisa something that comes from the curriculum as a TVET. So that after 3 months, when I basic, after 3 months we are Puma, we are Engale, because these kids are still young. I've seen some of them at El Dorado. They are young, those kids. They're still at 17, 18 years. So we're trying to correct them, but we still don't do what is expected. Then afumane ke ngoku that 3-month certificate, Chair, because ICT is good, Yona. Within 3 months you can get a job if you get the right course. The course that is done by the relevant people. So the teams are busy working now with those stakeholders that must help us to make this a better training. I always make an example of the kids that were trained by eGov during COVID-19. Those kids are working in the clinics. They are data capturers now. They did 6 months course. Then they continued after that, but it was a registered course, a proper course that it will take them somewhere. So that's why we're going to do that, even us, because now we're not sorting out the problem that we're supposed to sort. Instead, we are wasting the money. That's wasteful expenditure that we are doing, because we give an NPO that money, but do you have value for money? We don't have it because that person doesn't go out and work. It's a person that, a certificate, utsho ngomlomo uthi hayi bendisesikolweni, akayenzi loo nto leyo. Ze nincede ke niqhwaba nje, ndabazi ngaba basekhaya futhi abaqhwabayo. Ze nindincede, aba bantwana singathi mabaye esikolweni, bajike bangayi. Nani nibayeke, nithi makalale xa fanele kuvuka ekhosini. So nisincede ke nisenzele loo nto leyo. I will hand over to HOD then to talk to other issues that NPOs have raised. But we are noting these things. And I'm happy one man and Buzba, in Tony Kamalayo, NPO Yako. Diamba Chen, up on the Hulakona go, develop Kangelama NPOs in the last week, when was Zingela Latin Zingela Bantu Katleong. Man, dear nobody of Velems in Gnome. Did you work on Kangelani NPO lab? I've seen a lot, but what I've seen, Chair, which we are going to look at solely, because we deal on a policy. I want him to look at the policy. That's why in detail, next financial year, I'm going to fund every ward NPO yayo. Zabeni kona nifandwa, nizawufandwa nani, but every ward I want an NPO chair, because izawusinceda loo nto leyo wansenze njalo. And we are going to have a category. I know it is umthetho wethu, umuntu makabe na 10 years, I don't know how many years, but makabe mdala kule nto leni. Ndifuna umuntu angekho mdala, abantu abancinci, abaqali NPO, azena, bazawuregister sakwenza road shows between June and July. So Usoli is under pressure because by September, abo bantu bandenze road shows in all these regions. They must get inside bafumane imali yabo. We're going to have a standard amount of money that we give them. Out of the budget, that 1.9 on Betele Yona Alliance Africa, out of that in Zabin City, Kula 1.9, I've taken this 20,000. Dianigeza abantu ke ngoku bonke baqala umcimbi benzi NPO so that but siphinde siba attach ke ngokwezinkulu ukuthi obani bazahamba bayobafundisa bona ukuthi how do we do things. The only thing that we are going to overcome this, Chair, it's when I have then legislation that bends a bit what government is saying, but it's going to happen, Chair, in the next financial year. How much there will be that in those NPOs that are coming from the wards. Amaqina labe khona wona maqina nizabe nincedisa babakasayo because at the end nizawuphuma nabo funeka nabo ba benefit andithi so noba umuntu uthi sithina siyajima kuphela omnye athi mna ndiyabafida nje ukutya omnye athi mna ndibafundisa homework, but we're going to have a plan of doing that. And it's going to be my priority. Before I do that, it will be my priority. Because namale ambayo, and man is tuga ngabi ambil, it's 35 million. Matondo ingane kakula malup matondo. Matondo ibingane this year. No, namanga. Mamela, matondo, it was how much? It was 36 million matondo. Imali esiyibuyiseleyo nayo nam ndiyakhala njengawe because that money we should have done a lot. Whether it's 36 million na ininzi kuandithi because we don't have money. So ayizuphinde ihambe ze ninditheste kulona unyaka uba kuzaba nemali ebuyelayo na. No money will go back. Because why ingazuhamba? Because every week, Chair, I want to know how much have we spent. How much is left? So towards the third quarter, ndizabe ndiyigqiba yonke la mali. Uba ndiyigqibanga ndizakwenza iplans zoba mayigqitywe la mali. Part of the plans is these NPOs, Chair, ezisakhasayo. Ndizayiqala kulo nyaka le ndaba le nditsho usola kazulala as of this week. Because ndiqala kulo nyaka mawungathi kuyashiyeka 100 million, ndiyayithatha ndiyifaka kwabantu abatsha, ndibafakele i-NPO zabo. So izawusebenza imali yonke phu. Mna ndiyakwazi ukutywa kwemali andithi. Niyayazi uba imali yenziwa njani nandithi. Sayisebenzisa. Yonke nje futhi. Ngama-receipt kodwa ndithi. Nangemisebenzi. Enkosi.
Thank you very much, Chair. We are going to just do a summary of some of the questions we've received. Those NPOs that have specific issues that they are raising with us, we are asking them to just at the end of the meeting come at the front here so that we can pay attention to those. The Wattville Men's Forum, the Felix Methodist Orphanage Home, the, I think it's Tandi Mfundo Organization, and the Recovering Immunity Network. All of those people that have specific issues, can they just come to the front, or we will get, SIPO is actually doing something similar. So we will get that information from them. There was a question about school uniform from the gentleman at the back there, whether school uniform can be taken out of tenders. I have the CFO to answer to that.
Okay, in terms of the school uniform budget, whether it can be taken off the tender, in 2018, the department, there was a classification circular that was issued by Treasury to say that any procurement of goods and services, the budget must be allocated under goods and services. So it did not only affect the school uniform, it affected food parcels budget, it also affected dignity packs. So those budgets were then moved from NPO to goods and services to align with the classification circular that was issued by National Treasury. And then if we didn't move it, because the department tried to challenge Treasury in that, because we were empowering our cooperatives, and therefore we tried to reason with them, but they indicated that we will be having irregular expenditure if we do not move that budget. So the movement of budget was necessitated by that classification circular so that the department comply. Thank you.
Don't do that, don't do that. We told you this is the premises of the legislature. We don't want to throw you out. Okay. Thank you, CFO. HOD, are you covered now? Are you?
I'm covered, Chairperson.
Yeah,
We just need a coordination with SIPO so that we get all the specific questions about deviation and not
no,
getting
like I showed them,
responses.
SIPO and John. Thank you.
Okay, thank you.
Honorable members, MEC, we have concluded. You see, even the service provider who provided gas here, he thought he will get maybe half a gas, but the bottle is finished. So he has really worked for the money. The food are finished. So we have now come to the end of our session, and I really like to thank you also. Honorable Mekho is going to thank you, but Honorable Mekho, before you give us vote of thanks, the literacy level in this meeting was so high. I counted those who were wearing these gadgets. I think it's only 10 people in it. So I can see that everyone here can prat and speak. So thank you very much. And you even know the budget. You were so good with the budget. Even others miss it with around 66 million, but you can see they are counting. Honorable Mekho, I think can take us through vote of thanks.
Thank you so much, Chair. Let me first thank the MC and the department led by the HOD. With your capable team, you are trying your level best to do what you are required to do for the citizens of Gauteng. I hope other provinces can learn from you. At times when we ask difficult questions, remember we're not asking for ourselves, we're asking on behalf of the citizens. So at times you must bear with us. We are not actually personal, but it's because we're asking, because wherever we go to, even citizens are asking us as to what are you doing in that oversight committee. In absentia, let me also thank Councillor Kenny Ranyawa, who opened this meeting and allowed us as a host in this Ward 30 in Wardville to be able to use this hall. Let me also thank all members of the portfolio committee. Some had to leave early because of other engagements. I will be failing in my duty if I don't thank you as our stakeholders, because the kind of work that you do it on behalf of our government, but in particular you are assisting the department to be able to change the lives of our people. Lika Muso, Liska Khatala, we might be having challenges, but I think we will get there in one of those days. But also thank you very much for having raised critical questions, critical inputs, and also the advices. Some of the advices that were noted down by Mr. Nwala and Mr. Muloi, as a committee, we're going to be looking into that so that as we present our Q4 report and the budget vote at the Gauteng Provincial Legislature, we're able to actually recommend to the department what should happen. But also in particular to ensure that we follow through. Umama, oye wasukuma uite, don't give money, you know, if I were to translate, don't give money and not follow through. It is the responsibility of this team to ensure that when you allocate money, HOT, you follow through, because not you need to follow through. Go now, no MEC Guti. Are you following through in terms of the money that you allocate? Because this is the public purse. It is the money that comes from the citizens, from the taxpayers. Therefore, masingadlali ngezimali zabantu. Let us ensure that everybody must actually account and be accountable. Sibonge nama translators wethu for providing a service. Abasenzele ukudla bathi ukudla bekumnandi impela. I'm sure nathi ya siyabonga. Ngibone ngokuthula kwenu ukuthi ukudla kumnandi kuyayehla. As a result, nami sengilambile ngilambiswa yini. But bangitshela ukuthi cha bangibekele nje okuncane engizoyehlisela ngoba seniqede konke ukudla. Ithi sibonge kakhulu ningadula nangomso when you call you to come and allow the department to account to you. Thank you, and thank you so much.
Thank you very much, Honorable Mekwe. Those gadgets, they don't operate on your phone. In fact, they have tracker. So make sure that you leave them or they will come to collect them. Don't go with them. We don't want to see you, police coming to your house. Bring those gadgets. Thank you very much.